Good morning, everyone. I hope you had a very good night's sleep. Oh, Abhishek ji, namaskar, namaskar. So, beta, let's finish the topic for the day. Beta, I have shared the PDF yesterday night. Probably the team is editing it and they will be sharing with you. मैंने रात को ही send कर दिया था. Don't worry, it will be provided to you. आपके लिए बनाई है बेटा. Okay. So, वो यार वरुण पटेल जी नाम सर्च करिएगा आ जाएगा. चलिए, let's start now. लेट्स स्टार्ट विद रेस्पिरेटरी सिस्टम. इसमें हम पहले पढ़ेंगे एस्थमा, और एस्थमा के लिए बेटा दो टाइप के ड्रग्स होते हैं, आइदर ब्रोंकोडाइलेटर और एंटी इंफ्लामेटरी. ब्रोंकोडाइलेटर कब देते हैं? ड्यूरिंग एन एक्यूट अटैक ऑफ एस्थमा. एंड द ओवरऑल ड्रग ऑफ चॉइस फॉर एक्यूट अटैक ऑफ एस्थमा now has become formoterol. अब क्या है बेटा? Formoterol drug of choice है. What is formoterol? It is a beta 2 agonist. But what are the other drugs we have? The mnemonic among bronchodilator we have is Batman. Batman stands for beta 2 agonist. Anticholinergic drugs like ipratropium, tiotropium. Then we have Theophylline, which is found in tea and coffee. And lastly, we have magnesium sulfate. What about anti-inflammatory drug? They prevent inflammation so that another attack of asthma is prevented. They are given for chronic asthma. And the drug of choice for chronic asthma now has become ICS. ICS stands for inhalational corticosteroids, which I am going to tell you. But what are the other anti-inflammatory drugs we have for asthma? Remember, mast cell stabilizers. मास्ट सेल स्टेबलाइजर में बेटा हमें क्रोम वर्ड ढूंढना है. कौन सा वर्ड ढूंढना है? क्रोम वर्ड ढूंढना है. तो पहला ड्रग हो गया क्रोमोग्लाइकेट एंड नीडोक्रोमिल. देन वी हैव अ ड्रग लाइपोऑक्सीजनेस इनहिबिटर, जो ल्यूकोट्रीन के प्रोडक्शन को कम करते हैं. सिर्फ ड्रग का नाम याद रखना है, जेड से जिल्यूटॉन. यूज्ड इन एस्थमा, वेरी कॉमनली आस्क्ड क्वेश्चन. Then we have leukotriene receptor antagonist. These drugs they will end with the word leucast. इनके एंड में क्या वर्ड आएगा? ल्यूकास्ट वर्ड आएगा. आपने सुना होगा मॉन्टेल्यूकास्ट एंड जाफिरल्यूकास्ट. Lastly, we have certain new monoclonal antibodies for asthma. Now, let's talk about which monoclonal antibodies are given in asthma. This is an important question. The first one we all know is a very famous monoclonal antibody, omalizumab, given in asthma. Now, remember all these monoclonal antibody, they will have Li word in them. सबके बीच में Li word आ रहा है, देख रहे हो आप? Li मतलब lowering the immunity. तो omalizumab blocks IgE. IgE से एस्थमा या टाइप 1 हाइपरसेंसिटिविटी होती है. मेपोली एंड रेस्लीजुमैब दे ब्लॉक इंटरल्यूकिन 5. इंटरल्यूकिन 5 से भी एस्थमा होता है. बट बेनरालिजुमैब में आरए वर्ड आ रहा है. आरए का मतलब इट इज इंटरल्यूकिन 5. आरए मींस रिसेप्टर एंटागनिस्ट. ये रिसेप्टर को ब्लॉक करता है. सो मेपोली डायरेक्टली इंटरल्यूकिन 5 को ब्लॉक करता है. बेनरालिजुमैब उसके रिसेप्टर को ब्लॉक करता है. Okay, metformin causes weight loss. Now, beta 2 agonist, what are the drugs we have? We have three types: SABA, LABA, and ultra LABA. SABA stands for short acting beta 2 agonist. Short acting beta 2 agonist. तो LABA क्या होगा? Long acting beta 2 agonist. And ultra LABA will be ultra long acting beta 2 agonist. दो तीन ड्रग्स के नाम याद रखने हैं. SABA में salbutamol and terbutaline. ये दो नाम हमें याद रखने हैं. लाबा में दो नाम याद रखने हैं. पहला सेलमेटरॉल एंड बैम्ब्यूटरॉल. एंड अल्ट्रा लाबा में इंडैक्टिरॉल एंड क्लेनब्यूटरॉल. पहला सवाल, कौन सा बीटा 2 एगोनिस्ट बैन हो गया? विच बीटा 2 एगोनिस्ट हैज बीन बैंड? दैट इज क्लेनब्यूटरॉल. इट हैज बीन बैंड. व्हाई? बिकॉज इट हैज एनाबॉलिक इफेक्ट. इससे मसल मास इंक्रीज होता था. तो जिसको 2 महीने में सलमान खान बनना होता था, जिम जाके बॉडी बनानी होती थी, वो इसको अब्यूज करता था. नाउ अ वेरी इंपॉर्टेंट क्वेश्चन, विच ड्रग हैज बोथ साबा एंड लाबा प्रॉपर्टी? कौन सा बीटा 2 एगोनिस्ट साबा भी है और लाबा भी है? जो ड्रग ऑफ चॉइस बन चुका है आज की डेट में एस्थमा में, फॉर्मेटरॉल. It has both short and long acting action. Now this is very important beta. What are the side effects of beta 2 agonist? Remember 2T and 2H. ये बहुत commonly पूछा जाता है. So beta 2 agonist के side effect 2T, 2H. T for tremors. Tremors is the most common side effect of beta 2 agonist. क्योंकि मसल्स पे बीटा 2 रिसेप्टर होते हैं, ट्रेमर्स होता है. हार्ट पे टेकीकार्डिया. नाउ दिस इज वेरी इंपॉर्टेंट. रिमेंबर इनसे ब्लड में पोटेशियम का लेवल कम होता है. दे डिक्रीज पोटेशियम बट दे इंक्रीज ब्लड ग्लूकोज लेवल. सो कैन वी से दे प्रोड्यूस हाइपोकैलीमिया बट दे प्रोड्यूस हाइपरग्लाइसीमिया. सो एमसीक्यू मिलेगा, क्या ये हाइपोग्लाइसीमिया करते हैं कि हाइपरग्लाइसीमिया? रिमेंबर दे प्रोड्यूस हाइपरग्लाइसीमिया. ओके. Yes. Now the next question is, what is the main mechanism of action of theophylline in asthma? Remember theophylline चाय में होता है and their main mechanism of action is they are phosphodiesterase 4 inhibitor which increase the level of cyclic AMP which causes bronchodilation. Now what are the side effects of theophylline? Very important question. They are found in tea and coffee. Remember a mnemonic सुहाग. तो सुहाग नहीं उड़ जड़ना चाहिए. ज्यादा चाय कॉफी पियोगे तो ब्रेन में दौरे पड़ते हैं, सिजर होते हैं. बहुत ज्यादा यूरिन आता है, यूरिनेशन. हार्ट में दिल धक धक करता है विच इज एरिथमिया ज्यादा चाय पीने से. पेट में जलन होती है दैट इज जीआईटी अपसेट. और ज्यादा चाय पियोगे तो सिर में दर्द होगा, हेडेक होगा. पहला सवाल जो पूछा जाता है, सिजर और यूरिनेशन क्यों होता है विद थियोफिलीन? बिकॉज थियोफिलीन ब्लॉक एडिनोसिन रिसेप्टर. एडिनोसिन का A1 रिसेप्टर. सर जीआईटी अपसेट और हेडेक क्यों होता है? बिकॉज इट इज अ फॉस्फोडाइएस्ट्रेज इनहिबिशन. सर हार्ट में एरिथमिया क्यों होता है? बिकॉज ऑफ बोथ रीजंस. सो दिस इज अ वेरी वेरी फ्रीक्वेंटली आस्क्ड क्वेश्चन. अंडरस्टूड दिस पार्ट? Next question, which drug for asthma produce this side effect? Now can you tell me white patches on skin? White patches on tongue. Yes, the patient is suffering from oral thrush. Oral thrush means कौन सी फंगस का इन्फेक्शन? मुंह में कैंडिडा का इन्फेक्शन हो जाता है and this is the side effect of inhalational corticosteroids. Inhalational corticosteroids, remember, they can reduce immunity in the body which can lead to an opportunistic infection of oral thrush. What is the treatment? ट्रीटमेंट इज जब भी इनहेलेशनल कॉर्टिकोस्टेरॉइड लो उसके बाद वाटर से माउथ को गार्गल करो ताकि कॉर्टिकोस्टेरॉइड माउथ में डिपॉजिट ना हो पाए. सो इनहेलेशनल कॉर्टिकोस्टेरॉइड कैन कॉजेस ओरल थ्रश. नाउ मैग्नीशियम सल्फेट इज अ वेरी इंपॉर्टेंट टॉपिक nowadays. You are finding many questions. Remember, what are the uses of magnesium sulfate? Magnesium is given for the treatment of one arrhythmia. It is the drug of choice for treatment of torsades de pointes. Magnesium is also used as an antacid. Magnesium, calcium, barium, they are in same periodic table in chemistry if you remember. So they are given for barium and calcium poisoning. Because magnesium inhibit the entry of barium and calcium into the cell. Now this is a very important point. Magnesium has a laxative effect. Laxative means it causes diarrhea and any drug which causes diarrhea is given for the treatment of constipation. Now magnesium is the drug of choice for scissors in pregnancy and magnesium is given for emergency in asthma known as status asthmaticus. So these are the uses of magnesium. Very very important question. Now when we give magnesium, magnesium inhibit calcium entry into the cell. The muscles will not contract. So what is the earliest sign of magnesium toxicity? The muscles will become paralyzed and we check muscle contraction by Neve's hammer or patellar reflex or knee jerk. So that is why there is loss of patellar reflex. The muscles will not contract is an earliest sign of magnesium toxicity. That is deep tendon reflex will be lost. Very good. Done? Yes, knee jerk. Next question, drugs for cough. Remember, we have mainly two types of drugs for cough. The first is expectorant. Expectorant, they will expel the mucus out. So they will remove the mucus out. And in which cough we have mucus production? Remember, they are given for the treatment of productive cough. Productive cough occurs due to infection. Agreed. So we have three drug A, B, C. A for ambroxol. Bro word is coming. Bromhexine. Again, bro word is coming. And then we have cysteine. Any drug having cysteine will be used, like N-acetylcysteine, carbocysteine. So these are the drugs which are expectorant. Then we have antitussives. Antitussives, they will go to the brain and they will directly suppress cough centers. तो आदमी को खांसी ही नहीं होगी. That is why they are given in the treatment of dry cough. But remember, antitussive drug, this is a very frequently asked question. They are contraindicated in productive or infective cough, because if you will suppress cough, what will happen? So this ambroxol, bromhexine, these are mucolytic drugs only. Now they are contraindicated because the infection will not go outside. We have three drugs, DO and DON. D stands for dextromethorphan, and dextromethorphan in brain blocks NMDA receptor. It is an NMDA blocker. Then we have opioids like morphine and codeine and their congeners. And lastly, we have noscapine. One question comes that which drugs for cough are highly addictive? We know that opioids like morphine and codeine, their abuse is very common. So they show highly addictive drug. That is why nowadays we prefer to use dextromethorphan and noscapine. These names are very important. Let's talk about kidney and CBS, and in kidney, let's start with diuretics. So the first class of diuretic is carbonic anhydrase inhibitor. They will end with the word zolamide or amide. Question comes that acetazolamide is a diuretic. It acts on which part of the nephron? The first part of the nephron is PCT. So they act on proximal convoluted tubule. Where they are used? They are used in glaucoma, because eyes also has this enzyme, and they are the drug of choice for acetazolamide. We discussed yesterday, it is the drug of choice for mountain sickness as well. Now, why they are ending with the word amide? Because they are derivative of sulfonamide, and any drug which contains sulfa causes sulfa allergy. It causes sulfa allergy, and because of sulfa allergy, it causes bone marrow suppression. Now, acetazolamide increases ammonia level in body, and that is why ammonia will not be converted into urea if the patient is having liver disease. That is why these drugs are contraindicated in a patient of liver disease. Next question, osmotic diuretic, a very famous drug we have is mannitol. So mannitol, where does it act? Yesterday, last year's question, the next part of the nephron. So the next part of the nephron is this one. So this is known as loop of Henle. So it acts on loop of Henle. Now mannitol is an osmotic diuretic. That is why in blood or plasma, it increases plasma osmolarity, which will reduce the production of CSF. And if there is decrease in production of CSF, mannitol decreases intracranial pressure. Similarly, it also decreases aqueous humor production in eye. That is why it also decreases intraocular pressure. Because of this reason, mannitol, it is the drug of choice for cerebral edema, in which there is increase in intracranial pressure. Similarly, it is also given in the treatment of glaucoma. So question comes, which two diuretics are given in glaucoma? One is acetazolamide, second is mannitol. And it is also given in a disease known as dialysis disequilibrium. What happens in dialysis disequilibrium? When we take out the blood of the patient, there is fall in plasma osmolarity. So plasma osmolarity decreases because the blood is outside, which causes cerebral edema. Hence, to maintain plasma osmolarity during dialysis, we give mannitol in our patient to prevent cerebral edema. Now, two important points with mannitol is, mannitol excrete metals in urine. So, any drug which is a metal, yes, lithium is a metal, and platinum is also a metal, that is cisplatin. So, it is given in the treatment of lithium and cisplatin toxicity. Now, when the plasma osmolarity is increased, plasma volume expands, and if there is increase in plasma volume, can we say it will put more pressure on the heart? That is why Mannitol is a diuretic which is absolutely contraindicated in a patient of heart failure because it increases plasma volume by increasing plasma osmolarity. So which diuretic is contraindicated in heart failure? That is mannitol. Then we have the most effective diuretic, that is loop diuretic. Now where loop diuretic acts? Loop diuretic acts on TAL, thick ascending limb, and loop diuretic inhibit one transporter in thick ascending limb, that is sodium potassium 2 chloride transporter. So loop diuretic acts on thick ascending limb of nephron. So we have first mercury containing loop diuretic Mersalil. It is not used because mercury is highly ototoxic. And the other drugs which nowadays we use are sulfur containing drug like furosemide, torsemide, bumetanide. Now these are high ceiling diuretic, that means they are the most effective diuretics we have. Now what is the main side effect of loop diuretic? Loop diuretic in blood decreases all ions. They produce hyponatremia, hypokalemia, hypomagnesemia and hypocalcemia. But remember, what about thiazides, which I am going to discuss? Thiazides also decrease all sodium, potassium, magnesium, but thiazide increases blood calcium level. That means thiazide inhibit calcium excretion in urine. So thiazide inhibit the excretion of which ion? Calcium ion in urine. That is why thiazides are given in the treatment of renal stones. So which diuretic is given in the treatment of renal stone? Because if calcium is excreted in urine, it will form stones anywhere in urinary tract. So we give thiazide diuretics in the treatment of renal stones. Very commonly asked question. Let's talk about thiazide. Thiazide, they act at DCT. That is distal convoluted tubule, and they inhibit one transporter known as sodium chloride symporter. They inhibit sodium chloride symporter in DCT. So we have drugs like thiazides. They will end with the word thiazide. And we have thiazide-like drug chlorthalidone, metalozone, indapamide. So CMI. So chlorthalidone, metal wala drug metalozone and indapamide. One question comes that which thiazide is safe in renal failure? Metal wala drug, that is metalozone, is safe in renal failure. That means low GFR conditions, we can give thiazide diuretic. So thiazide diuretics, metalozone is the safe drug. Now let's talk about now vasopressin agonist. So vasopressin agonist, these drugs, they will end with the word pressin. So the first drug we have is terlipressin. Terlipressin stimulate V1 receptor. D for desmopressin. Desmopressin stimulate V2 receptor. Where terlipressin is given, V1 receptor is present on blood vessel which produce vasoconstriction. That is why it is given to constrict dilated veins. Dilated veins are known as varices. So it is the drug of choice for bleeding esophageal varices. So what is the drug of choice for bleeding esophageal varices? That is terlipressin. But yes, we can also use octreotide. But now the drug of choice is terlipressin. Now desmopressin, it is present on V2 receptor. V2 receptor is present in kidney and it reabsorbs water. That is why desmopressin is the drug of choice for neurogenic diabetes insipidus. When ADH hormone or vasopressin hormone is not secreted from neuron, then we give desmopressin from outside. Remember, there is another disease known as nephrogenic diabetes insipidus. In nephrogenic diabetes insipidus, the ADH receptors are defective. Desmopressin cannot act on nephrogenic DI. Here the drug of choice is thiazide diuretics. So neurogenic, desmopressin, nephrogenic, give thiazide diuretic. Now let's talk about a very important topic, very frequently asked, that is nocturnal enuresis or bedwetting in children. So a child requires treatment if the age of the child is more than 6 years and still the child is passing out urine while he or she is asleep. So the first treatment, remember, is not drug. First treatment is training of the child. And in training of the child, remember a method known as alarm method. In alarm method, when the child is going to pass out urine, an alarm which is in the clothes of the child will ring and the child will wake up, and the child will wake up and voluntarily goes and pass out urine. But if it fails, then we start a drugs. And three drugs which have been approved for nocturnal enuresis is DOI. D stands for desmopressin. Second is oxybutinin. Remember yesterday's class oxybutinin? It will relax bladder, detrusor muscle, and one antidepressant, imipramine. Imipramine. So these three drugs are used, and the overall drug of choice is desmopressin. So remember three drugs for nocturnal enuresis. Fine. Now let's talk about hypertension. Now what is essential hypertension? Essential hypertension means the blood pressure is more than 130/80, but the patient is having no comorbidity. There is no risk of no other diseases present. This is known as essential hypertension, and the three drugs for first line drug for essential hypertension are CAT. C stands for calcium channel blocker, DHP type, and these drugs they will end with the word dipine. Like example, any famous drug you know, amlodipine. The second drug you can use is ACE inhibitor or the brother of ACE inhibitor, ARB. So either they will end with the word pril or they will end with the word sartan. And which diuretic is given? Thiazide diuretics are given for the treatment of essential hypertension. You can start any of the following drug depending upon the patient in a patient of essential hypertension. But the things becomes changed in hypertensive crisis. Hypertensive crisis means when the BP is more than 180/20. Now it is of two type, either urgency. Urgency means right now there is no organ damage. Emergency means there is already an end organ damage. So organs have been damaged, like stroke has happened, MI has happened, renal failure has happened, aortic dissection has happened. So hypertensive urgency, the most preferred drug is clonidine. But you can also use labetalol. While in hypertensive emergency, now the drug of choice has become IV nicardipine. Now the drug of choice has become IV nicardipine, but you can also use nitroprusside. You can also use nitroprusside as well. Okay, so these are the drugs for hypertensive crisis. Let's talk about drugs for angina. The first line drug for angina are three drugs, BCN, beta blocker, calcium channel blocker, and nitrates. Now beta blocker, remember LOL drug, which will end with the word LOL, like metoprolol, atenolol. They are the drug of choice for chronic. Chronic means long-term treatment of stable angina. While calcium channel blocker, they are the drug of choice for chronic vasospastic angina. What about nitrates? Nitrates, when given sublingually, they are the drug of choice for acute attack of angina. And when they are given orally or transdermally, they can be given in all types of chronic angina. Now the question is that what is the mechanism of action of nitrates in angina? Nitrates, they are venodilator. That is why they decrease preload to the heart. So what is the action of nitrate? They are venodilator. The blood which is coming to the heart is reduced. This is the action of nitrates. Now let's talk about second line drug for angina. Now this is important. So the mnemonic is N-drift. Now N stand for nicorandil. Recently asked question. You can see nicorandil, CO, dil word is coming. CO means it is a coronary dilator. Sir, AN word is coming. That means it is given in the treatment of angina. The mechanism of action of nicorandil is it is a potassium channel opener, which causes blood vessel dilation. Then we have dipyridamole. Dip word is coming. Dip means dip हो गया, खत्म हो गया. That means this drug has been banned. कौन सा एंजाइना का ड्रग बैन हो गया? डिप वाला बैन हो गया. डाइपाइरिडामोल बिकॉज इट वाज कॉजिंग कोरोनरी स्टील सिंड्रोम. It was causing coronary steal syndrome, ban ho gaya. Then we have ranolazine. Na word is coming. It is a sodium channel blocker. Then we have ivabradine. Brady word is coming. It causes bradycardia. How it causes bradycardia? Because it inhibits SA node. How it inhibits SA node? Because it blocks some funny channels on SA node. It blocks some funny channels on SA node. Then we have trimetazidine. I and meta word is coming. It inhibit. Meta means metabolism. It inhibit metabolism of fats by inhibiting one enzyme, PFOX enzyme, partial fatty acid oxidation. Now, if the heart will not able to utilize fat, the heart will shift the metabolism to glucose. Now the heart will use glucose instead of fats because glucose requires less oxygen. So trimetazidine inhibit metabolism. Understood this part? These are the tricks how to remember the names of the drug. Recent question was, where do we use trimetazidine? Trimetazidine is given in angina. Next question, which drug we should never combine? Remember, beta blockers should never be combined with two calcium channel blocker, that is verapamil and diltiazem. Remember, verapamil and diltiazem are calcium channel blocker. Both these drugs, they act on heart. Patient will die suddenly because of bradycardia. Then nitrate should not be combined with sildenafil and tadalafil. Sildenafil and tadalafil are phosphodiesterase inhibitor, 5 inhibitor. Remember, it will lead to marked hypotension and the patient will die suddenly. Now, where do we use sildenafil and tadalafil? Sildenafil comes with the brand name Viagra. Sildenafil and tadalafil, they are the drug of choice for impotence or erectile dysfunction, which also occurs in old age patient. In old age patient, nitrates also occurs. So remember, अगर एक आदमी हनीमून बनाने जाएगा, नाइट्रेट पहले से लगाया हुआ है, लव लाइफ को अच्छा करने के लिए सिल्डेनाफिल या वाइग्रा खाएगा, तो सडनली जब माहौल बना होगा, परफॉर्मेंस का टाइम आएगा, आदमी की सडन डेथ हो जाएगी और ऐसी ट्रेजिक डेथ आप कभी भी नहीं चाहेंगे. यू डोंट वांट सच अ ट्रेजिक डेथ दैट बिफोर यू वांट टू मेक अ लव यू सडनली डाई ऑन अ बेड. So that will be a death which even our enemies should not experience. So let's talk about now chronic heart failure or CHF. So in heart failure, the heart is getting gradually damaged. So the question comes, what are the cardioprotective drugs we have in CHF? Because cardioprotective drugs in CHF, they reduce mortality. Yes, beta, Bangkok wali story jo humne padhi thi. So they reduce mortality in CHF. So the mnemonic is Sahibs. First new drug is sacubitril. What is this drug? I am going to tell you. Then we have ACE inhibitor and ARB, which are ending with the word pril, and sartan. You have to remember this list. Question comes. Then we have aldosterone receptor blocker, spironolactone, because aldosterone also damages heart. Then we have hydralazine, which is a potassium channel opener. Then we have funny channel blocker, ivabradine. We have beta blockers and SGLT-2 inhibitor. Now, the questions which are coming nowadays is, how many beta blockers are given in CHF? This question comes. How many beta blockers are given in CHF? Remember, only 4 beta blockers are given in CHF. Okay, so you can remember a mnemonic, New Bombay Municipal Corporation, New BMC. So N for nebivolol. सिर्फ 4 ही बीटा ब्लॉकर CHF में दिए जाते हैं. देन बिसोप्रोलॉल, मीटोप्रोलॉल, this was a last year question, and carvedilol. Another very important question is, which new drug for CHF has been approved? The new drug for CHF, which is a cardioprotective drug, has been approved is SGLT2 inhibitor, which I am going to tell you today shortly. So SGLT2 inhibitor, remember, they will end with the word gliflozin, and they are given in the treatment of diabetes mellitus as well. So any drug which ends with the word gliflozin, like canagliflozin, dapagliflozin, empagliflozin. So these drugs reduce mortality. Now, which drugs are absolutely contraindicated in CHF? Remember, calcium channel blockers are contraindicated in CHF, like verapamil and diltiazem, because calcium channel blocker, they rather increase mortality in CHF. Beta blocker reduce mortality, while calcium channel blockers increase mortality in CHF. We never give. So these are the three questions which are coming nowadays very commonly in CHF. Okay, let's talk about a drug that is sacubitril, which we have discussed. Now, another drug which we give in CHF is natriuretic peptide. Remember, natriuretic peptides, they are good for heart. And in our body, there is an enzyme which lyses or degrades natriuretic peptide. Let's name this enzyme as neprilysin. Nepri means natriuretic peptide. Lysin means degrading enzyme. This enzyme is also known as NEP enzyme. NEP stands for neutral endopeptidase enzyme. So we have two forms of drug in CHF. We have made recombinant form or synthetic form of brain natriuretic peptide. The drug is nesiritide. Nesiritide is a brain natriuretic peptide given in the patient of CHF. Then we have developed a drug which will inhibit this enzyme, neprilysin enzyme, which will increase the level of natriuretic peptides in our body. So neprilysin or NEP inhibitor drug we have is very, very important, sacubitril. Sacubitril increases the level of natriuretic peptides in our body. Yes, amlodipine can be given in CHF only to control hypertension, but itself for heart failure, it has no role. Now, a very important drug we have is cardiac glycoside. This drug is known as digitalis. So digitalis means it is obtained from a plant, digitalis plant. And from digitalis plant, we obtain a drug known as digoxin. Digoxin is obtained. Now, where digoxin is used, remember, digoxin, it is a positive inotropic drug. That means it increases force of contraction. Now the question is, how digoxin increases force of contraction of the heart? By inhibiting one transporter on heart, that is sodium potassium ATPase. So digoxin inhibits sodium potassium ATPase on heart. It is an inotropic drug, but digoxin inhibits SA node and AV node on heart. That means it decreases heart rate. Inhibition of SA node is known as negative chronotropic. Inhibition of AV node is known as negative dromotropic. Now, what are the uses of digoxin? Because it increases force of contraction, it is given for decompensated heart failure. Decompensated heart failure means when the cardiac output is falling. And where digoxin is given? Digoxin inhibits SA node and AV node. It is given for the treatment of SVT or atrial fibrillation because of this reason. Okay, now let's talk about side effects of digoxin. Commonly asked question. The most common side effect of digoxin is nausea and vomiting. Now, very important question. In eyes, digoxin causes yellow vision. Yellow vision is a side effect of digoxin, which is known as xanthopsia. Now, which drug causes blue-green color blindness? Blue pill, that is sildenafil. Now, which drug causes red-green color blindness? One drug for tuberculosis, ethambutol. And lastly, digoxin also causes gynecomastia. Now, this is the list of the drugs which causes gynecomastia. The mnemonic is DISCO. So, the commonly asked question is digoxin. Which TB drug causes gynecomastia? Isoniazid. Which aldosterone blocker causes gynecomastia? Spironolactone. Which antifungal drug? Ketoconazole. Which proton pump inhibitor? Omeprazole. Fine. Now, we have already discussed yesterday the antidote of digoxin, that was Digibind. Now let's talk about the last part of CVS, that is anti-arrhythmic drug. And to classify anti-arrhythmic drugs, we use a classification known as William Vaughan-Singh classification. According to this classification, anti-arrhythmic drugs are classified into five classes. 1, 2, 3, 4, 5. Let's focus on 1 to 4. The mnemonic to remember is SOBI-POCA. SO for sodium channel blocker, beta blocker, potassium channel blocker, and calcium channel blocker. Now, beta blockers are under class 2, except one beta blocker, that is sotalol. Sotalol is under class 3. So, which beta blocker is not under class 2? That is in class 3, that is sotalol. Now, let's talk about first class 1A agent. Class 1 agents are divided further into 1A, 1B, and 1C. 1A mnemonic is Cupid. For FMGE, just try to remember the names, nothing else. Quinidine, prokinamide, diisopyramide. 1B, leave PMT. Leave PMT. And lignocaine, remember, it is given in the treatment of ventricular fibrillation. It is given in the treatment of ventricular fibrillation. And 1C, famous PM, Prime Minister, flecainide, propafenone, morisizine. So these are the drugs we have in 1. For calcium channel blocker toxicity, beta, yesterday we discussed na, give calcium gluconate, antidote and drug combination हमने एक ही जगह पढ़ लिया था. Now the more important is class 3 agents, which is potassium channel blocker. Remember, potassium channel blockers are of two types. Potassium channel blocker, two drugs we have. One is class 1A. Class 1A blocks sodium as well as potassium, and class 3 agent. And any drug which blocks potassium channel causes QT prolongation. And QT prolongation can lead to one arrhythmia known as TDP. TDP stands for torsades de pointes. So which anti-arrhythmic drug themselves can cause torsades de pointes, which blocks potassium channel? Let's focus on class 3. Potassium channel blocker, the drugs are DIVAs, dofetilide and ibutilide, Varnakelant, now this is very important, amiodarone, and which beta blocker is under class 3? That is sotalol. And remember, amiodarone is a very important drug for your FMG exam. Amiodarone पे बहुत सारे सवाल आते हैं. So amiodarone, it is the drug of choice for VF. Remember, drug of choice for VF is amiodarone. पहले होता था lignocaine. अब क्या drug of choice है? अब drug of choice बन गया है amiodarone. Now, what is the side effect of amiodarone? Remember, in amiodarone, IOD word is coming. IOD means it contains iodine. And iodine can cause thyroid problem. It causes hypothyroidism and hyperthyroidism. Okay, that is why we made a drug, dronadirone. Dronadirone, no iodine. No iodine, no thyroid problem. So amiodarone causes thyroid problem. Now amiodarone deposits in cornea. When amiodarone deposits in cornea just like a tree, this is known as cornea verticillata. Cornea verticillata. It causes liver cirrhosis. It causes lung fibrosis. And color of iodine, you know, you have seen betadine. Betadine, purple color. When deposit on skin, amiodarone causes purple man syndrome. Purple man syndrome. Yes. Now let's talk about class 5 agent, miscellaneous. Atropine. Atropine is the drug of choice for bradycardia. Digoxin, it is given for the treatment of SVT in heart failure. Now adenosine is very important. It is the drug of choice for PSVT. And magnesium sulfate, it is the drug of choice for torsades de pointes or long QT syndrome. So in PSVT, we will see this part. Adenosine, another very important drug for you. So two drugs in arrhythmia you have to remember, amiodarone and adenosine. Amiodarone class 3 agent, adenosine class 5 agent. Let's talk about this ECG. So in this ECG, you cannot see P wave. Remember, if there is absent P waves, this is PSVT. Paroxysmal supraventricular tachycardia. Sir, what is the drug of choice? The drug of choice is ABC. So A for adenosine. Adenosine is given IV, hence it is given for acute attack of PSVT. Now, what is the dose of adenosine? This was a recent question. The dose of adenosine is 6, 12, 12 milligram. So maximum you can give 3 injections up to 30 milligram is the maximum dose of adenosine. Then we have beta blocker. Beta blocker are long acting drug. They are given for chronic or long-term treatment of SVT. They are given for long-term treatment of SVT. But the problem with both adenosine and beta blocker is they are contraindicated in asthma. Now the question comes, if the patient is having asthma with SVT, then we give calcium channel blockers like verapamil. So remember, whenever asthma is there, we don't give beta blocker, we rather give calcium channel blockers. So remember, this is a very important question you have to remember. Now let's talk about autocoids. Drugs acting on following serotonin receptors. Remember, a recent question was, what is another name of serotonin? Serotonin is also known as 5-hydroxytryptamine. Recent question of FMGE. That is why the receptors of serotonin are known as 5-HT. So, first drug, 5-HT1A agonist. The drug is buspirone. 2A word is coming, anti-anxiety drug. It is an anti-anxiety drug. Now, this is very important. Which drug is 5-HT1B and 1D agonist? 1B and 1D agonists are triptans. Heard about sumatriptan and ergotamine. So these drugs are given in the treatment of acute attack of migraine. Now which drug is 5-HT4 agonist? Remember, these drugs, they will end with the word pride. Like cisapride, prucalopride. They are given as prokinetic drug for the treatment of constipation. Lastly, which drug is 5-HT3 antagonist? These drugs are known as cetron, like ondansetron, granisetron, and they are used as an antiemetic drug for the treatment of nausea and vomiting. So these are the 4 classes of drug you must remember. One question comes always from this list is these drugs. Let's discuss these drugs one. So first is 5-HT1B 1D agonist. So the drugs are triptans like sumatriptan, rizatriptan, elatriptan, frovatriptan. And another drug we have is ergotamine. So they are the drug of choice. Now the triptans have become the drug of choice for acute attack of migraine. Now what are their side effects? These drugs, they produce vasoconstriction in fingers. Vasoconstriction in fingers will lead to dry gangrene of fingers. So dry gangrene of fingers means this is known as ergotism. So remember one statement which I am going to tell you. If you take ergot, the fingers will rot. Remember like this. If you take ergot, the fingers will rot. So this is ergotism which can occur with drugs for migraine. Now let's talk about prevention of migraine. If a patient is having frequent attacks of migraine, so prophylaxis of chronic migraine. The drugs we have BACT backed, and the overall drug of choice for prevention of migraine is propranolol or beta blocker is considered to be the drug of choice for prophylaxis of migraine. But if beta blockers are contraindicated in asthma, bradycardia, what are the other agents we have? So we have 3 anti-epileptic drugs: valproate, topiramate, gabapentin. Which calcium channel blocker is used? Flunarizine. Which tricyclic antidepressants are used? Amitriptyline, nortriptyline. Now we have new drugs for migraine. They have been asked once in FMGE exam. They are CGRP inhibitor. CGRP full form we don't have to remember. It is calcitonin gene related peptide inhibitor. So either these drugs, they will end with the word gepant. Gepant word will come. CGRP inhibitor, and there is one monoclonal antibody which has been approved for prevention of migraine, that is Erinumab. Erinumab is a monoclonal antibody that blocks CGRP2, some calcitonin gene related peptide. Now let's talk about chemotherapy induced nausea and vomiting. Chemotherapy means beta anti-cancer drug, they can cause nausea and vomiting, and maximum risk is with an anti-cancer drug cisplatin. Now, if nausea vomiting happens and if this nausea vomiting is in early phase means the vomiting is lasting for less than 24 hours, then the drug of choice is Cetron. 5-HT3 antagonist, they are the drug of choice for early phase. Ondansetron, Granisetron. So they are overall the drug of choice for chemotherapy induced nausea and vomiting. But if this vomiting lasts for more than 24 hours, that means they are lasting for more than 24 hours, nausea and vomiting, it is known as delayed phase. Delayed phase means beyond 24 hours. Then we give other drugs as an add-on drug. Then we have a drug, very important drug, Pitant. Question of last year FMGE, Pitants, they block which receptor? They block NK1 receptor. NK1 stand for neurokinin 1 receptor. And these drugs, they will end with the word Pitant, like Apripitant, Netipitant, etc. If it is still not controlled, we give corticosteroid. Lastly, if it is still not controlled in refractory cases, we give cannabinoid agonist. They stimulate CB1 receptor of cannabinoid, and these drugs will have NABI word in them. क्या नाम आएगा? NABI word आएगा. So the drugs are Nabilone and Dronabinol. NABI word आपने ढूंढना है. So Dronabinol and Nabilone, they are given for chemotherapy induced nausea and vomiting. Expect one question from this slide. Amifostine beta alag hai. Now prokinetic drug, they increase GIT contractility. That is why they are known as pro matlab increase karna, kinetic matlab contractility. Where they are used? They are used in 3 conditions. They contract LES, lower esophageal sphincter. They are given in GERD. They contract stomach. They are given for gastroparesis when the stomach is not contracting. And they contract intestine. That is why they are given in the treatment of constipation. So these are the 3 uses of prokinetic drug. What are the drugs we have? The first drug we have is 5-HT4 agonist. These drugs, they will end with the word pride, like Cisapride, Mozapride. They are prokinetic drug. And a very important question, Prucalopride. आपसे पूछा जाता है प्रोकैलोप्राइड कौन से रिसेप्टर पे काम करता है? 5-HT4 रिसेप्टर पे काम करता है, स्टिमुलेट करता है जीआईटी कॉन्ट्रैक्टिलिटी. प्रोकैलोप्राइड क्या हम कॉन्स्टिपेशन में देते हैं? यस, इट इज अ ड्रग फॉर कॉन्स्टिपेशन. अमंग देम यस्टरडे वी डिस्कस्ड सीजाप्राइड गॉट बैंड. क्यों बैन हो गया था? टॉर्साइडिस डिपॉइंटिस या क्यूटी प्रोलोंगेशन. कल हमने कैट ड्रग्स पढ़े. देन वी हैव अ ड्रग डोपामीन एंटागनिस्ट, डोपामीन के रिसेप्टर को ब्लॉक करने वाला. द ड्रग इज डोमपेरिडोन. डोमपेरिडोन GERD constipation. Then we have a drug neostigmine. Neostigmine increases acetylcholine level. It is given for the treatment of constipation which occurs in paralytic ileus. Now we have a drug which have all three actions. Can you guess the drug? That drug is 5-HT4 agonist, dopamine antagonist, and increases acetylcholine level. The drug is metoclopramide. The drug is metoclopramide, has all three actions. Now, can we say metoclopramide also block dopamine receptor? Let's talk about domperidone and metoclopramide. They both block dopamine receptor, but there is a difference between domperidone and metoclopramide. Domperidone does not cross blood-brain barrier, while metoclopramide, it crosses blood-brain barrier. Now, can you tell me, if a drug enters into the brain, It blocks dopamine receptor. That is why metoclopramide, because it crosses blood-brain barrier, it can lead to drug-induced Parkinson's disease. And in Parkinson disease, we know it occurs because of blockage of dopamine receptor. The muscles become rigid, and if the muscles become rigid, we call it as muscle dystonia. So metoclopramide muscle dystonia करता है. It is not seen with domperidone. That is why, what is the treatment? The treatment of muscle dystonia or Parkinson disease is we give a drug benzhexol. We give a drug benzhexol. Benzhexol is an anticholinergic drug which is given for the treatment of drug-induced Parkinson's disease. Benzhexol देंगे, ठीक है? Now let's talk about which prostaglandin is helped given to maintain patency of ductus arteriosus. Ductus arteriosus को ओपन रखने के लिए the answer is L-prostadil, which is prostaglandin E1. Now, which drug is given to close a patent ductus arteriosus? The answer is ibuprofen or indomethacin. They are given to close patent ductus arteriosus. Fine, दो ड्रग्स हम यूज कर सकते हैं. Now let's talk about NSAIDs. What are NSAIDs? NSAIDs are non-steroidal anti-inflammatory drug. They inhibit one enzyme, COX enzyme. COX enzyme means cyclooxygenase enzyme, which decrease prostaglandin production. Now, the first drug is aspirin. Aspirin is an antiplatelet drug. It is given in the treatment of MI and stroke. Then we have nimesulide. Nimesulide, we will write banned. Why? It was hepatotoxic and it causes Stevens-Johnson syndrome. Phenacetin got banned. It was causing kidney damage, which is known as analgesic nephropathy. Then we have rofecoxib, valdecoxib. They are selective COX-2 inhibitor. These drugs also got banned because they were increasing the risk of MI and stroke. So these are the few NSAIDs which got banned. We have to remember. Now let's talk about two important points with aspirin, which is very commonly asked question. So first is race syndrome. Race syndrome means when we give aspirin to control viral fever like COVID-19, influenza. Have we given aspirin in COVID-19? No. Remember, whenever we give aspirin in presence of viral infection, in some people it can lead to liver damage, fulminant hepatic failure. That is why aspirin is contraindicated in a patient of viral fever. This is known as race syndrome. बेटा PDF शेयर किया था किड्जी जी, आज आ जाएगा. Then we have samtostriide. Samtostriide is seen with aspirin and other NSAIDs also. ये MCQ था. दूसरे NSAIDs भी कर सकते हैं. And remember, they can cause allergic disease like asthma and ethmoidal polyp in nose. That means when we give aspirin-like drug, they increase the risk of allergic disease. So this triad is known as samtostriide. Okay, samtostriide. Done. Next point is paracetamol. Another name of paracetamol is acetaminophen. Wherever the word comes, safest drug, go with paracetamol. So it is the safest drug in children because no risk of race syndrome. It is the safest drug in renal failure. It is the safest drug in pregnancy. So wherever the word comes, safest drug, give paracetamol. Now, what is the main side effect of paracetamol? Sir, paracetamol goes to the liver and it makes a toxic form. The toxic form of paracetamol is NAPQI, and this NAPQI causes liver damage. NAPQI causes liver damage. So the main side effect of paracetamol is hepatotoxicity. Now, what is the antidote of paracetamol hepatotoxicity? N-acetylcysteine. Because N-acetylcysteine removes the toxic from the liver, NAPQI. It removes NAPQI from the liver. So that is why paracetamol antidote is this. Now let's talk about drugs for gout. Drugs for gout, they reduce blood uric acid level. Now how uric acid is produced? Remember, there is a purine known as hypoxanthine, which goes to the liver, and there is an enzyme known as xanthine oxidase enzyme, which converts hypoxanthine into uric acid, and then this uric acid is excreted into the urine. Okay, so the first drug which will reduce the production of uric acid from hypoxanthine is xanthine oxidase inhibitor. So the drugs are allopurinol. Sir, how we can remember allopurinol? It is also a purine, just like hypoxanthine. Oxypurinol, it is also a purine, just like hypoxanthine. And the third drug we have is febuxostat. Now febuxostat is a very commonly asked question. It is a xanthine oxidase inhibitor. How we can remember? Exostat word is coming. What does exo here stands for? Exo stands for xanthine oxidase. Stat means inhibitor, and remember, they are the drug of choice for chronic gout. To reduce blood uric acid level, they are the drug of choice. Then the second drug we have, which converts uric acid into allantoin. So the drug that converts uric acid into a harmless molecule, that is allantoin, we have uric acid oxidase enzyme like rusp-uricase and pegloticase. So these enzyme converts uric acid into allantoin, and they are given in resistant cases of chronic gout to allopurinol. One common cause of resistant cases of gout is tumor lysis syndrome. When tumor cells they die, they make purines and gout happens. They are used there. Lastly, we have a drug which increase the excretion of uric acid into the urine, uricose uric agent. Just try to remember probenecid only. For FMGE, just remember one drug, probenecid. Other drugs are required for NEET exam. Fine. So these are the drugs we have. Now let's talk about rheumatoid arthritis. And in rheumatoid arthritis, we use a drug known as DMARDs. DMARD stands for disease modifying anti-rheumatic drugs. So we have older drugs. Older drugs are known as conventional DMARDs. They are older drugs. And the drugs which are given in rheumatoid arthritis, the mnemonic is in front of you. Malika Sherawat Pagal Si. ठीक है? Sundar Si nahi, Pagal Si. So methotrexate, it is overall considered to be the drug of choice. And the mechanism of action of methotrexate is it inhibits one enzyme, DHFR enzyme, which stands for dihydrofolate reductase enzyme. So these are the other names. These drugs we are going to discuss later on. Okay? Now we have new DMARDs. Now the questions are coming nowadays on new DMARDs. So these new DMARDs are generally monoclonal antibodies. So first we have a drug which will block TNF-alpha. TNF-alpha is tumor necrosis factor alpha, which causes this hypersensitive disease, rheumatoid arthritis. The drugs are ICAGE. So I for infliximab. For exam, try to remember infliximab. And the next drug is etanercept. Then a recent last year question for FMGE, which drug blocks interleukin 6? Tocilizumab. Which drug blocks CD20? Rituximab. And which is a Janus kinase inhibitor? Tofacitinib. Now remember, all these drugs are given by injection. Tofacitinib is an oral drug. And tofacitinib, it is also given in the treatment of IBD. What is IBD? Ulcerative colitis and Crohn's disease. हम टोफासिटिनिब अल्सरेटिव कोलाइटिस और क्रॉन्स डिजीज में भी देते हैं लास्ट ईयर्स एमसीक्यू. ओके बेटा. नाउ लेट्स टॉक अबाउट एंडोक्राइन and expect two questions from diabetes mellitus. And first, let's talk about insulin, which is used in diabetes mellitus. So insulin, it is ultra short, lispro, aspartame, glulicine. We have short acting insulin, regular insulin. Then we have intermediate acting lente and NPH insulin. Now question comes, lente insulin is a mixture of amorphous insulin and crystalline insulin. What ratio? 30:70. So this is a question. Then we have NPH, neutral protamine histone, and then we have long-acting insulin, glargine and degludec. First question. Now, which is the longest-acting insulin? This question comes. Now you already know the answer. Degludec. It is now considered to be the longest-acting insulin, which acts for 42 hours. Now all these insulin are given by subcutaneous injection. But which insulin is given? IV. IV insulin is regular insulin, and IV drugs we give during emergency, and this IV insulin, it is considered to be the drug of choice for DKA. DKA stands for diabetic ketoacidosis. Insulin is also given in the treatment of hyperkalemia. In these two emergency scenarios, we give IV regular insulin. Now, which insulin will be peakless? Which is very long-acting insulin. Long-acting insulin are peakless insulin. So we have two long-acting insulin, that is glargine and degludec. Okay. Now among them, glargine, remember, is an acidic insulin. Because of acidic pH, it is never mixed with other insulin in same injection. We never mix glargine with other insulin in same injection. Lastly, a recently approved nasal insulin, which is approved as a nasal spray. So the new insulin which is approved as a nasal spray is Afrezza. So Afrezza is a nasal insulin we have. Now let's talk about drugs which are used in diabetes, oral hypoglycemic agents. Now the first drug we have is sulfonylurea. How to identify the name of sulfonylurea? They will end with the word amide, chloropropamide, acetohexamide, or they will start with the word gly. They will start with the word gly. Then we have meglitinides. They will end with the word glenide. Now, two questions which come on amide, gly and glenide drugs are that these drugs, they are insulin secretagogue. They are insulin secretagogue. That means they increase the secretion of insulin. Now, don't you think if they increase the secretion of insulin, they have a side effect of causing hypoglycemia? They produce hypoglycemia as a side effect. So, the most frequently asked question is, which drugs in diabetes causes hypoglycemia? Remember, only 3 drugs in diabetes causes hypoglycemia. First is insulin. Second is sulfonylurea, which you can identify with the word amide or gly. And lastly, we have meglitinides, which will end with the word glenide, like ratiglenide, natiglenide and repaglenide. No other drugs in diabetes causes hypoglycemia. And what is the treatment of hypoglycemia? The treatment of hypoglycemia, we can give glucose, but we can also give glucagon also. So we can give glucagon hormone for the treatment of hypoglycemia. Okay. Now let's talk about other drug. Then we have glucagon-like peptide 1. Glucagon-like peptide 1 agonist. These drugs are known as incretins. Remember, these drugs, either they will end with the word natide or they will end with the word glutide. So exenatide, lixisenatide, LB, dula, liraglutide, semaglutide. Okay. Now any drug which ends with the word tide is a peptide. Peptides are not given orally. Pepsin, trypsin degrades them. So all these drugs are given by injections. Now a very frequently asked question is semaglutide. It is the only oral drug we have. Which is the only oral drug we have in GLP-1? That is semaglutide is the only oral GLP-1 agonist we have. Now semaglutide and a new drug tirzepatide. These drugs are approved as an and right liraglutide also. So these three drugs are approved as an anti-obesity drug because these drugs they produce weight loss, which we are going to discuss. A new drug is teduglutide. Teduglutide is GLP-2 agonist. It is not GLP-1 agonist, it is 2. 2 means tedu. T means 2. It is rather given in the treatment of short bowel syndrome. कहाँ देते हैं teduglutide बेटा? It is given in the treatment of short bowel syndrome. Teduglutide, last year FMG question. Understood? Now we have DPP-4 inhibitor. DPP-4 inhibitor, they inhibit some dipeptidyl peptidase enzyme. They increase the level of endogenous. They inhibit the degradation of GLP-1. So they increase the endogenous level of incretins like glucagon like peptide 1. These drugs, they will end with the word gliptins. Sitagliptin, vildagliptin, alogliptin, linagliptin. Now remember, linagliptin renal failure में लेना है. कौन सा ड्रग रीनल फेलियर में सेफ है? Linagliptin is renal safe. This is a very frequently asked question. Then we have metformin and fenformin. They inhibit liver hepatic gluconeogenesis. So metformin inhibit hepatic gluconeogenesis in liver, glucose production in liver. Agreed? Now what is the main side effect of metformin? Very important. Most common side effect of metformin is unexplained diarrhea. Last year MCQ. Metformin causes megaloblastic anemia. Why? Because metformin decrease vitamin B12 absorption from GIT. And lastly, the most dangerous side effect of metformin is it causes lactic acidosis. Metformin causes lactic acidosis. Because of this reason, fenformin got banned. तो कौन सा ड्रग है अब? अब है सिर्फ metformin. Now metformin is the drug of choice for type 2 diabetes mellitus, which can occur in PCOD. है ना? PCOD में भी होता है ना? Type 2 diabetes mellitus. So we start with metformin. Okay. Now let's talk about very important class of drug. Expect one question from here. एक सवाल पक्का है. That is SGLT-2 inhibitor. These drugs they will end with the word gliflozin. इन ड्रग के एंड में क्या वर्ड आएगा बेटा? ग्लिफलोजिन वर्ड आएगा. फाइन. कैना, ग्लिफलोजिन, डैपा, एम्पा, रेमो, R2, सोटा. ग्लिफलोजिन वर्ड देखना है. SGLT स्टैंड फॉर सोडियम ग्लूकोज ट्रांसपोर्टर इनहिबिटर. That means these drugs they inhibit sodium and glucose absorption from kidney. That is why sodium and glucose will be excreted in urine. Sodium and glucose will be excreted in urine. कैसे याद करें? इन ड्रग्स में फ्लो वर्ड आ रहा है. सो कौन सा ड्रग यूरिन का फ्लो बढ़ाएगा? SGLT2 inhibitor. Now, first question. Side effect. Can we say which drug causes glycosuria? यूरिन एक्सक्रीशन. यूरिन में ग्लूकोज का एक्सक्रीशन. ग्लिफलोजिन वाले ड्रग ग्लाइकोसूरिया करेंगे, विच कैन लीड टू UTI. UTI means urinary tract infection. That is why the patient will have bacterial infection and candida infection in urine. So remember this part. These drugs causes UTI. Now because they cause sodium excretion in urine, they have anti-hypertensive effect. They have cardioprotective effect. And they have renoprotective effect. ये किडनी को भी बचाते हैं. Because they have cardioprotective effect, they are given in CHF, chronic heart failure. पढ़ा था अभी हमने chronic heart failure. They are also given in the treatment of CKD. CKD is chronic kidney disease. So these are very important class of drug. Now remember, pioglitazone, rosiglitazone, they are PPAR gamma agonist. These drugs are contraindicated in heart failure. while ग्लिफलोजिन वाले ड्रग्स दे आर गिवन इन द ट्रीटमेंट ऑफ हार्ट फेलियर। सो कौन से डायबिटीज के ड्रग हार्ट फेलियर में नहीं देते? पायोग्लिटाजोन और रोजीग्लिटाजोन हार्ट फेलियर में नहीं देते, फ्लोजिन वाले ड्रग हार्ट फेलियर में देते हैं। अंडरस्टूड दिस पार्ट? ठीक है। नो बेटा, ये कार्बोज इज नेवर सुपीरियर। नाउ वन लाइनर्स इन डायबिटीज। डायबिटीज में स्टमक पैरालाइज हो जाता है, वी गिव द ट्रीटमेंट विद वन एंटीबायोटिक नोन एज एरिथ्रोमाइसिन, because erythromycin stimulates motilin receptors on stomach, मोटिलिन रिसेप्टर्स ऑन स्टमक। ठीक है, स्टमक की पैरालिसिस ठीक हो जाती है, मोटिलिटी बढ़ जाती है। नाउ डायबिटिक रेटिनोपैथी में क्या होता है? पेशेंट को रेटिना में एबनॉर्मल ब्लड वेसल्स बननी शुरू हो जाती है, जिससे ब्लीडिंग होती है, नियोवैस्कुलराइजेशन होती है। ट्रीटमेंट एक ही ड्रग याद रखना है, बेवाकीजुमैब। कैसे देते हैं? इंट्रा विट्रियल इंजेक्शन। बेवाकीजुमैब कैसे काम करता है? इट इनहिबिट VEGF। आई होप यू रिमेंबर द फुल फॉर्म ऑफ VEGF, वैस्कुलर एंडोथीलियल ग्रोथ फैक्टर, विच इनहिबिट्स द फॉर्मेशन ऑफ ब्लड वेसल्स और नियोवैस्कुलराइजेशन। कैसे याद करें? बी से ब्लड वेसल का फॉर्मेशन इनहिबिट करेगा बेवाकीजुमैब। VE वर्ड आ रहा है, मतलब ये VEGF को इनहिबिट करता है बेवाकीजुमैब। नाउ रीसेंट क्वेश्चन, व्हाट इज द ड्रग ऑफ चॉइस फॉर डायबिटिक न्यूरोपैथी? द ड्रग ऑफ चॉइस फॉर डायबिटिक न्यूरोपैथी इज प्रीगाबालिन। Pregabalin is the drug of choice for diabetic neuropathy. Now, which diabetes drug does not require any dose modification in renal failure? बताओ बेटा, रीनल फेलियर में कौन सा ड्रग लेना है? रीनल फेलियर में कौन सा ड्रग लेना है? लीनाग्लिप्टिन लेना है रीनल फेलियर में। Now, which drug is contraindicated in renal failure? लिखोगे मेटफॉर्मिन। मेटफॉर्मिन को हम रीनल फेलियर में नहीं देते। ठीक है, ये याद रखना है फॉर एग्जाम। नाउ लेट्स टॉक अबाउट ड्रग्स फॉर ऑस्टियोपोरोसिस। सो ऑस्टियोपोरोसिस में सर बोन वीक हो जाती है, सो द फर्स्ट क्लास ऑफ ड्रग वी हैव इज which will inhibit osteoclast, and the second class of drug we have is which stimulates osteoblast, so they will increase bone mineral density. तो बोन की डेंसिटी इंप्रूव हो जाएगी, ऑस्टियोपोरोसिस ठीक हो जाएगा। विच ड्रग inhibit osteoclast or bone destroying cell? BCDE, and the overall drug of choice is bisphosphonate. Overall drug of choice for osteoporosis is bisphosphonate. Okay, bisphosphonate are the drug of choice. So bisphosphonate drugs के नाम के एंड में आता है ड्रोनेट वर्ड आता है, like एलेंड्रोनेट, जोलेंड्रोनेट। इसमें जोलेंड्रोनेट वर्ड याद रखना है, इसको वंस अ ईयर देते हैं। नाउ बिसफॉस्फोनेट का साइड इफेक्ट हमें याद रखना है, दे कैन कॉज ऑस्टियोनेक्रोसिस ऑफ जॉ, they can cause osteonecrosis of jaw and they can cause reflux esophagitis. ये esophagus को डैमेज करते हैं, reflux esophagitis. Then we have a drug which stimulate osteoblast, which will cause promotion bone, they will promote bone formation, which is teriparatide. Teriparatide, para T word आ रहा है, it is a parathyroid hormone. It is stimulates osteoblast. It is given as a subcutaneous injection intermittently. रुक रुक के देते हैं, कंटिन्यूसली नहीं देते। इसका मेन साइड इफेक्ट है एक कैंसर होना, ऑस्टियोसार्कोमा। ऑस्टियोसार्कोमा इज द साइड इफेक्ट ऑफ टेरिपैराटाइड। ओके, ऑस्टियोसार्कोमा और ऑस्टियोनेक्रोसिस, डोंट गेट कंफ्यूज बिटवीन देम। बिसफॉस्फोनेट causes osteonecrosis of jaw, teriparatide causes osteosarcoma. Now few anti-thyroid drug. The first class of drug we are having is thyroid peroxidase inhibitor. So first we have is PTU, propylthiouracil, carbimazole and methimazole. PTU, it is the drug of choice in first trimester. Carbimazole and methimazole, they are the drug of choice for second and third trimester of pregnancy. Carbimazole and methimazole, they are also the drug of choice for Graves' disease. They are also the drug of choice for Graves' disease. Then we have iodides, potassium iodide, sodium iodide and Lugol's iodine. Lugol's iodine पूछा जाता है. Lugol's iodine is 5% iodine with 10% potassium iodide. Now iodides, they are given in thyroid storm, which I am going to discuss. Lastly, we have radioactive iodine 131, which destroy thyroid with the help of beta rays. It emits beta rays which destroy thyroid gland. Its half-life is 8 days. And where you will give? It is given for inoperable cases of hyperthyroidism. जब आप सर्जरी नहीं कर सकते तब हम रेडियोएक्टिव आयोडीन देते हैं, लाइक ओल्ड एज पेशेंट्स में. ओके, वी हैव डिस्कस यस्टरडे प्लेसिया क्यूटेस. नाउ which of the following drugs are given in thyroid storm? Remember a mnemonic. thyroid storm में हम ड्रग देते हैं PPID. कितने ड्रग देते हैं बेटा थायराइड स्टॉर्म में? PPID. And as we are going from up to down, the drug of choice for thyroid storm is one beta blocker, propranolol. These are the drugs we have thyroid storm. And remember, these drugs also inhibit T4 to T3 conversion. ये T4 को T3 में भी कन्वर्ट नहीं होने देते. एक एंजाइम होता है जो T4 को T3 में कन्वर्ट करता है, दैट इज 5-D iodinase enzyme. Which enzyme converts T4 to T3? 5-D iodinase enzyme, जो एक आयोडीन रिमूव कर देता है T4 में से, T3 बन जाता है. So propranolol is a beta blocker which inhibit 5-D iodinase enzyme. It is the first drug to be started in thyroid storm. After that, we start propylthiouracil, and in resistant cases, we give iodides and dexamethasone. So this is the treatment of thyroid storm. Now let's talk about SERMs. SERM full form, I hope you remember, selective estrogen receptor modulator. So the first drug we have is tamoxifen. So tamoxifen is the drug of choice for ER positive, estrogen receptor positive breast cancer. But its side effect is tamoxifen increase the risk of endometrial cancer. Then we have raloxifene. Raloxifene is given in the treatment of postmenopausal osteoporosis. But remember, any osteoporosis, I have told you the drug of choice is bisphosphonate. The great advantage of raloxifene is no risk of एंडोमेट्रियल कैंसर. सो एंडोमेट्रियल कैंसर किसके साथ देखा जाता है बेटा? टेमोक्सिफिन के साथ देखा जाता है. नाउ क्लोमिफीन, इट इज द ड्रग ऑफ चॉइस एज एन ओव्यूलेशन इंड्यूसर इन PCOD. और मिलॉक्सिफिन, इंपॉर्टेंट ड्रग. और मिलॉक्सिफिन इज ऑल्सो नोन एज सेंटक्रोमान. And it is used as a contraceptive. And this ormiloxifin or centcroman, it is a made in India drug. It is made by CDRI Lucknow, Central Drug Research Institute. It comes with the brand names Saheli and Chaya. It comes with the brand name Saheli and Chaya. Then we have fulvestrant. Fulvestrant is known as SERD, selective estrogen receptor down regulator. It blocks estrogen receptor everywhere. How we can remember? Full means everywhere. ESTR means estrogen. ANT means antagonist. It is given for the treatment of tamoxifen resistant breast cancer. Then we have a drug, very important, aromatase inhibitor. Now what is the function of aromatase enzyme? To convert testosterone into estrogen. In a postmenopausal female, testosterone is converted into estrogen. So aromatase inhibitor, they inhibit the conversion of testosterone into estrogen. So the drugs are letrozole, zole word aayega, vorozole. And remember, they are the drug of choice for postmenopausal breast cancer. Because in postmenopausal female, estrogen is produced from testosterone from adrenal gland. So letrozole and vorozole are, ठीक है, एरोमटेस इनहिबिटर. लेट्रोजोल वर्ड नहीं भूलना बेटा बिल्कुल भी. डन. आगे बढ़ते हैं. लेट्स टॉक अबाउट ड्वार्फिज्म. जीओटी है ना, द बेस्ट पर्सन इन जीओटी. ड्वार्फिज्म, हाइट को बढ़ा दो. हाइट को बढ़ाने के लिए कौन सा ड्रग देना है? सर वी हैव टू गिव द ड्रग ऑफ चॉइस एज ग्रोथ हार्मोन. द नेम ऑफ द ड्रग इज सोमा, मतलब ग्रोथ. ट्रोपिन मतलब ग्रोथ को प्रोमोट करने वाला ड्रग. सोमाट्रोपिन इज द ड्रग ऑफ चॉइस फॉर ड्वार्फिज्म. एक्रोमेगली मींस जब एक्सेस हो जाता है ग्रोथ हार्मोन का, खाली बन जाता है आदमी, है ना, द ग्रेट खाली, है ना, ठीक है. नाउ फॉर एक्रोमेगली द फर्स्ट ट्रीटमेंट इज ट्रांसफिनॉइडल पिट्यूटरी रिमूवल. पिट्यूटरी को ही रिमूव कर दो यार. फर्स्ट ट्रीटमेंट इज सर्जरी. पहला ट्रीटमेंट क्या होगा बेटा हमेशा? एक्रोमेगली का सर्जरी. अगर लेट्स से सर्जरी के बाद भी ठीक नहीं हो रहा, सम रेजिडुअल है, देन द ड्रग ऑफ चॉइस इज somatostatins. Somatostatin, they decrease the production of growth hormone from pituitary, and these drugs they will end with the word riotide. इनके एंड में क्या वर्ड आएगा बेटा? रियोटाइड. कैन यू रिकॉल सर्टेन ड्रग विद रियोटाइड? ऑक्ट्रियोटाइड. लॉन्गेस्ट एक्टिंग ड्रग लेनरियोटाइड. सर अब भी ठीक नहीं हो रहा, इन रेजिस्टेंट केसेस गिव अ ड्रग पेगवीसोमांट. पूछा गया बेटा आपसे ये. पेगवीसोमांट कैसे याद करें? सोमा मतलब होता है ग्रोथ हार्मोन, ग्रोथ. एएनटी मींस एंटागनिस्ट, इट इज ग्रोथ हार्मोन रिसेप्टर एंटागनिस्ट. सो दिस इज द ट्रीटमेंट ऑफ पेगवीसोमांट. वर्ड याद रखना है. ऑक्ट्रियोटाइड रेजिस्टेंट केसेस वे गिव पेगवीसोमांट. ठीक है बेटा. लैंड्रियोटाइड की डोज कौन पूछने वाला है? कोई नहीं पूछेगा आपसे. ठीक है, क्यों याद करनी, है ना. हमें तो पैरासिटामोल की डोज याद करनी होती है ना. लैंड्रियोटाइड अभी थोड़ी ना दोगे आप. जब बन जाओगे एक बड़े से अच्छे से एंडोक्राइनोलॉजिस्ट बन जाओगे, बिल्कुल तब डोज याद करनी, अभी नहीं याद करनी. ठीक है. नाउ लेट्स टॉक अबाउट अ ट्यूमर प्रोलैक्टिनोमा. इन प्रोलैक्टिनोमा द ड्रग ऑफ चॉइस इज डोपामीन D2 receptor agonist. Remember, dopamine reduces prolactin production from pituitary. Remember. Now, the overall drug of choice is cabergoline. Because cabergoline सबसे इफेक्टिव ड्रग है. बट अगर वर्ड आ जाए प्रोलैक्टिनोमा इन प्रेगनेंसी, तब आप जाओगे ब्रोमोक्रिप्टीन के साथ. और अगर ये फेल हो जाती है, रेजिस्टेंट केसेस, यहां पे आप करोगे सर्जरी, ट्रांसफिनॉइडल पिट्यूटरी रिमूवल. तो प्रोलैक्टिनोमा में पहले ड्रग देना है, फिर आपने देना है ब्रोमोक्रिप्टीन एंड केबरगोलिन, बिकॉज दे विल डिक्रीज द प्रोडक्शन ऑफ prolactin hormone from pituitary. These drugs have one more use. They are also given to suppress lactation. Why? क्योंकि प्रोलैक्टिन प्रोडक्शन कम होगा तो मिल्क प्रोडक्शन नहीं होगा. एग्जाम्पल, इन मदर आफ्टर डेथ ऑफ नियोनेट. जस्ट इमेजिन, एक मम्मी ने बच्चा पैदा किया, बच्चा मर गया. डोंट यू थिंक वी हैव टू सप्रेस लैक्टेशन? सो फॉर दैट वी गिव केबरगोलिन एंड ब्रोमोक्रिप्टीन. नहीं बेटा, यस इट कैन बी गिवन बट इट इज नॉट द फर्स्ट लाइन ट्रीटमेंट. ऑक्ट्रियोटाइड या वही दिया जाता है. बुक्स में गलत लिखा हुआ है, एमसीक्यू बुक्स में. ठीक है, हैरिसन पढ़ो, जो हैरिसन में लिखा है वो पढ़ो. ठीक है अनिकेत जी. लेट्स टॉक अबाउट सीएनएस. मजा आ रहा है बेटा? मजा आ रहा है? चीजें रिकॉल हो रही है थोड़ी बहुत जो हम पढ़ रहे हैं? कॉन्फिडेंस आ रहा है? वो बहुत जरूरी है. विदाउट कॉन्फिडेंस मजा नहीं आएगा, है ना. तो थोड़ा सा कोरिलेट करके पढ़ो, क्लिनिकली इमेजिन करो. चीजें बड़ी इजी है, मुश्किल नहीं है. चलो बेटा, शाबाश. लेट्स मूव अहेड. पॉइजनस अल्कोहल. वन क्वेश्चन कम्स ऑलवेज ऑन पॉइजनस अल्कोहल. पहली पॉइजनस अल्कोहल मिथेनॉल. सेकेंड पॉइजनस अल्कोहल इथाइलिन ग्लाइकोल. Agreed? Now, all alcohols, they go to the liver. We have an enzyme, alcohol dehydrogenase enzyme, which converts them into aldehydes. Formaldehyde from methanol, glycol aldehyde from ethylene glycol. Then we have another enzyme, aldehyde dehydrogenase, which will convert them into acids. Formaldehyde from methanol will be converted into formic acid, while ethylene glycol will form glycolic and oxalic acid. Now remember beta, these acids are highly neurotoxic. These acids are highly neurotoxic. It can lead to blindness, respiratory depression, and the patient will die. So what is the antidote for methanol and ethylene glycol poisoning? Let's inhibit this enzyme. The antidote is fomepizole. Fomepizole is an antidote. But fomepizole is an orphan drug, not easily available because this condition is a very rare disease. Fomepizole, it is an alcohol dehydrogenase inhibitor. If it is not available, in that case, we can give ethanol to our patient. Now, can you tell me why we give ethanol? Ethanol is given to saturate these enzymes so that these alcohols will not be converted into acids which are highly neurotoxic. So, overall drug of choice is for methanol and ethylene glycol poisoning is fomepizole. Let's move ahead. Let's talk about now ethanol. बहुत दारू पीता है एक आदमी, एक दिन पैसे खत्म हो गए और उसे दारू नहीं मिली. क्योंकि उसे दारू नहीं मिली, the patient will go into withdrawal. The patient will come into emergency with acute withdrawal symptom known as delirium tremens. Patient को शांत करो. The drug of choice for delirium tremens is IV diazepam. ठीक है, अभी आगे की बात करते हैं. नाउ पेशेंट को आपने शांत कर दिया. नाउ सेंड द पेशेंट बैक होम सो दैट we will put the patient on maintenance phase so that patient should not go into another attack of withdrawal. The drug we give is oral chlordiazepoxide. सर कैसे याद करें? बहुत इजी है याद करना. डाइजीपाम, डाइजीपॉक्साइड दोनों एक जैसी ड्रग है. बेंजोडाइजपीन है, सेडेटिव ड्रग है. बट बोथ दीज ड्रग्स आर कॉन्ट्राइंडिकेटेड इन पेशेंट ऑफ लिवर डिजीज. अगर पेशेंट का LFT बढ़ा हुआ है then we cannot give these benzodiazepine. अगर पेशेंट को लिवर डिजीज है, in that case we give either lorazepam, liver safe drug, oxazepam. Lorazepam and oxazepam are liver safe drugs. Now slowly and slowly we will stop chlordiazepoxide. अब आदमी नशा मुक्त हो गया है, उसकी दारू पीने की आदत छूट गई है. Now the point is, after the patient has stopped drinking and the patient should not start again, we have to prevent relapse. दोबारा पीना ना शुरू करे, दूर रहे दारू से. For that we have anti-craving drug. In anti-craving we have combination of naltrexone with acamprosate, and we have a deterrent drug which will induce fear. That drug is disulfiram. So बेटा डाइसल्फिराम तब दिया जाता है जब आदमी दारू पीना छोड़ चुका होता है, दोबारा शुरू ना करे, तब हम देते हैं डाइसल्फिराम. Now what is this disulfiram? Disulfiram inhibits one enzyme, alcohol dehydrogenase enzyme. किसको इनहिबिट करता है? अल्कोहल डिहाइड्रोजनेस को इनहिबिट करता है. तो अगर आदमी ने दारू पी ली, बॉडी में क्या एक्यूमुलेट होना शुरू हो जाएगा? इन बॉडी एसिटाल्डिहाइड एक्यूमुलेट, एंड दिस एसिटाल्डिहाइड प्रोड्यूस हार्मफुल सिम्टम्स. इस हार्मफुल सिम्टम्स की वजह से पेशेंट को फियर रहेगा, लाइक वॉमिटिंग, हेडेक, चेस्ट पेन, और कई बार हाइपोटेंशन से डेथ भी हो जाती है आदमी की. दैट इज वाई डाइसल्फिराम इज ओनली गिवन टू प्रिवेंट रिलैप्स, ताकि आदमी दोबारा शुरू ना करे. डाइसल्फिराम इज एब्सोल्युटली कॉन्ट्राइंडिकेटेड इन एक्टिव ड्रिंकर्स. जो लोग एक्टिवली दारू पी रहे हैं उनमें हम डाइसल्फिराम नहीं देते. नाउ द पॉइंट इज देयर आर सर्टेन ड्रग्स which also show disulfiram like reaction, and these drugs should be avoided in active drinker. पहला ड्रग जो हमें दारूबाजों में नहीं देनी, that is metronidazole. Metronidazole should not be given in active drinker. It show disulfiram like reaction. And just remember one, cephalosporin, cefoperazone. cefoperazone में PE वर्ड आ रहा है. cefoperazone पीने नहीं देती. पीता कौन है? जो लोग मेट्रो सिटीज में रहते हैं. तो मेट्रो सिटीज में जो लोग रहते हैं, cefoperazone पीने नहीं देती बिकॉज दे शो डाइसल्फिराम लाइक रिएक्शन. सेकेंड ड्रग डी एडिक्शन इज ओपियोइड. ओपियोइड लाइक मॉर्फिन. अगर मॉर्फिन से एक्यूट पॉइजनिंग हो गई है, पेशेंट विल गो इनटू रेस्पिरेटरी डिप्रेशन एंड पेशेंट विल हैव पिन पॉइंट प्यूपिल. These are the features of morphine poisoning, and the drug of choice is antidote we discussed yesterday is IV naloxone. IV naloxone is the drug of choice. अब पेशेंट को आपने पॉइजनिंग से बाहर निकाल दिया. नाउ वी हैव टू गिव मेंटेनेंस फेज टू प्रिवेंट विड्रॉवल सिम्टम. 3 ओपियोइड्स अप्रूव्ड है. बोन मैरो ट्रांसप्लांट BMT. B स्टैंड्स फॉर ब्यूप्रीनॉर्फिन, मीथेडॉन, और रिसेंटली अप्रूव्ड हुआ है ट्रामाडोल. So these 3 opioids are approved for morphine addiction. Fine. अब धीरे धीरे आपने ड्रग को बंद कर दिया. अब आदमी दोबारा पीना शुरू ना कर दे, मॉर्फिन लेना ना शुरू कर दे. वी हैव टू प्रिवेंट रिलैप्स, ताकि उससे दूर रहे. द ड्रग इज ओरल नैल्ट्रिक्सोन. अब मुझे बताओ बेटा, आईवी नैलोक्सोन कहां देते हैं और ओरल नैल्ट्रिक्सोन कहां देते हैं? समझ आया? आईवी नैलोक्सोन एंटीडोट होती है एक्यूट पॉइजनिंग की. ओरल नैल्ट्रिक्सोन हम देते हैं टू प्रिवेंट रिलैप्स इन केसेस ऑफ मॉर्फिन और ओपियोइड एडिक्शन. नाउ लेट्स टॉक अबाउट विल्सन डिजीज. विल्सन डिजीज में क्या होता है? कॉपर डिपॉजिट हो जाता है. एग्रीड? सो इन विल्सन डिजीज वी गिव सर्टेन कॉपर चिलेटर्स. नाम याद रखने हैं. कॉपर चिलेटर पहला पेनिसिलामीन, जो हम रिमेटॉइड आर्थराइटिस में भी दे रहे थे. सेकंड आपने याद रखना है फॉर FMGE ट्रायंटीन. ये 2 नाम याद रखने हैं. सो इन विल्सन डिजीज वी गिव कॉपर चिलेटर, पेनिसिलामीन, ट्रायंटीन. द ओनली ड्रग फॉर रेट सिंड्रोम इज, 3-4 बार ये सवाल आ चुका है. रेट सिंड्रोम का एक नया ड्रग ट्रोफिनाटाइड. ट्रोफिनाटाइड टी और आर वर्ड आ रहा है. रेट में भी टी और आर वर्ड आ रहा है. सो पहले 2 नाम आपने याद रखने हैं. ट्रोफिनाटाइड. ओके. जिंक विंक देते हैं बट आपसे पूछा नहीं जाएगा. नाउ लेट्स टॉक अबाउट सर्टेन सिजर्स. फिब्राइल सिजर जो छोटे बच्चों में होता है, तो आपने देखना है चाइल्ड विद हाई ग्रेड फीवर. ये 2 चीजें देखनी है बच्चों में. फीवर 2 ड्रग्स. फर्स्ट इज रेक्टल डाइजिपाम, but a new drug which we can give is intranasal midazolam. Then we have infantile spasm. दूसरा नाम होता है वेस्ट सिंड्रोम. इसमें हम देते हैं ACTH हार्मोन. बट अगर यही इन्फेंटाइल स्पाज्म, इट इज एसोसिएटेड विद ट्यूबरस स्क्लेरोसिस, एक जेनेटिक डिजीज जिसमें फेस पे एंजियोफाइब्रोमा, लियोमायोमा, बड़ा कुछ होता है. यहां पे लाइफ लॉन्ग हमें देना पड़ता है वीगाबैक्ट्रिन. नाउ वीगाबैक्ट्रिन इज अ वेरी इंपॉर्टेंट ड्रग फॉर यू. VI से लिखेंगे. साइड इफेक्ट ऑफ वीगाबैक्ट्रिन, विजुअल abnormality. It causes visual abnormality. Mechanism of action लिखेंगे. GABA-trin वर्ड आ रहा है. It is a GABA-trin. It is a GABA transaminase inhibitor. ये GABA को डिग्रेड नहीं होने देता, GABA सीजर्स को ठीक कर देता है. So V GABA-trin, remember this part. Status epilepticus, acute seizures which needs to be controlled by IV drug, we give IV lorazepam, most commonly used drug. IV lorazepam for status epilepticus. Now let's talk about phenytoin. Phenytoin के side effect, first is cerebellar damage, toxicity. तो cerebellar damage होगा तो क्या होगा? ataxia, diplopia. cerebral damage, sorry cerebral नहीं, cardiotoxicity. ठीक है. देन अदर साइड इफेक्ट्स आर, इट कॉजेस हर्सुटिज्म, हाइपरप्लास्टिक गम्स, it causes hyperplastic gum and hirsutism. Lastly, it can also halt folic acid absorption. That is why it can lead to megaloblastic anemia. Megaloblastic anemia. Now, why it causes hirsutism and hyperplastic gums? PCOD. So, phenytoin can cause PCOD. What about valproate? Remember valp. Valproate, most common side effect is vomiting, nausea and vomiting. Valproate increases ammonia level, which can lead to encephalopathy, MCQ. To treat hyperammonemic encephalopathy with valproate, treatment is L-carnitine. क्या देना है बेटा? एल कार्निटीन देना है। लिवर टॉक्सिक इन चिल्ड्रन लेस देन 2 years of age and it causes PCOD, gender specific. Remember, polycystic ovarian disease अनफॉर्चुनेटली मेल्स में होगी कि फीमेल्स में होगी? तो कल हमने पढ़ा बेटा कि बीपीएच बिनाइन प्रोस्टेट हाइपरट्रॉफी मेल्स में होती है। अब आप मुझे बताओ पीसीओडी किस में होगी, कौन से जेंडर में होगी? अनफॉर्चुनेटली मेल्स में ओवरी नहीं होती। फर्स्ट एमसीक्यू। अच्छा, प्रणय जी ने दोबारा आंसर दिया है आपकी बार। सो पीसीओडी इज द जेंडर स्पेसिफिक साइड इफेक्ट ऑफ वैल्प्रोइड। लिवर टॉक्सिसिटी और हिपैटोटॉक्सिसिटी इज द एज स्पेसिफिक साइड इफेक्ट ऑफ वैल्प्रोइड। ओके, ये बात याद रखनी है, ठीक है? तो जेंडर स्पेसिफिक पीसीओडी। नाउ वेरी इंपॉर्टेंट क्वेश्चन, दो ड्रग है ऑक्स कार्बाजपीन, लिखेंगे ऑक्स कार्बाजपीन, देयर इज मोर रिस्क ऑफ हाइपोनेट्रीमिया। कार्बामाजेपिन मोर रिस्क ऑफ स्टीवन जॉनसन सिंड्रोम। अब बेटा पहला सवाल, हम सबने सुना है जॉनसन एंड जॉनसन बेबी पाउडर, तो बताओ कार्बामाजेपिन से स्टीवन जॉनसन सिंड्रोम कौन से एज ग्रुप में होगा? चिल्ड्रंस में होगा कि ओल्ड एज में होगा? स्टीवन जॉनसन, जॉनसन एंड जॉनसन बेबी पाउडर, बिकॉज ऑफ दिस रीजन अवॉइड देम इन चिल्ड्रन। तो कार्बामाजेपिन चिल्ड्रन में अवॉइड करो। हाइपोनेट्रीमिया बिकॉज ऑफ SIADH, इट अकर्स इन ओल्ड एज। तो O से ऑक्स कार्बामाजेपिन ओल्ड एज में नहीं देना, C से कार्बामाजेपिन चिल्ड्रन में नहीं देना, ठीक है बेटा? एमसीक्यू है। तो कौन सा एंटी एपिलेप्टिक ड्रग वेट लॉस करता है? It also has carbonic anhydrase inhibiting property. The side effect is angle closure glaucoma and renal stones. Remember one drug, topiramate. ठीक है, topiramate. Done? Very good. Neuropathic pain, trigeminal neuralgia, drug of choice is carbamazepine. पोस्ट हर्पेटिक न्यूरैल्जिया, ड्रग ऑफ चॉइस इज प्रीगाबालिन या फिर गाबापेंटिन, कोई भी दे सकते हो। डायबिटिक न्यूरोपैथी, ड्रग ऑफ चॉइस इज प्रीगाबालिन। सो दीज आर द ट्रीटमेंट ऑफ न्यूरोपैथिक पेन, ठीक है? नाउ वेरी इंपॉर्टेंट क्वेश्चन, वेरी फ्रीक्वेंटली आस्क्ड, अ पेशेंट ऑफ साइकोसिस और स्किज़ोफ्रेनिया प्रेजेंटेड टू इमरजेंसी विद मसल स्पाज्म, अपवर्ड गेजिंग ऑफ आइज, ब्रेडिकाइनेसिया, गेट एबनॉर्मेलिटी। पहले बताओ हुआ क्या है? अब ये पिक्चर पढ़ी थी हमने। सो द पेशेंट इज सफरिंग फ्रॉम ड्रग इंड्यूस्ड पार्किंसन डिजीज, विच इज ऑल्सो नोन एज मसल डिस्टोनिया। अब बेटा पहला सवाल, पेशेंट इज हैविंग स्किज़ोफ्रेनिया, द विच ड्रग में कॉजेस? The drugs which causes are antipsychotic drugs. Antipsychotic drugs, they produce drug-induced Parkinson disease because they block dopamine receptors. Remember few drug. पहला haloperidol और दूसरा एक ड्रग याद रखना है risperidone. And which drug we give for the treatment? For the treatment we have already discussed is benhexol. अभी हमने कोई प्रोकाइनेटिक ड्रग भी पढ़ा था, मीटोक्लोप्रोमाइड भी यही कर रहा था, तो मीटोक्लोप्रोमाइड ऑल्सो प्रोड्यूस सेम साइड इफेक्ट, ठीक है? वी ऑलरेडी नो. नाउ क्लोजापीन इज अ वेरी इंपॉर्टेंट ड्रग. क्लोजापीन इज एन एंटीसाइकोटिक ड्रग. एंटीसाइकोटिक ड्रग इज क्लोजापीन. क्लोजापीन के साइड इफेक्ट पूछे जाते हैं बेटा, नॉन सीरियस एंड सीरियस साइड इफेक्ट. नॉन सीरियस इज मेटाबॉलिक सिंड्रोम. मेटाबॉलिक सिंड्रोम में क्या होता है? देयर इज ओबेसिटी एंड टाइप 2 डायबिटीज मेलाइटस, ठीक है? आदमी मोटा हो जाता है क्लोजापीन से. देन इट कॉजेस हाइपर सेलिवेशन, एक्सेसिव सेलिवेशन, रिसेंटली आस्क्ड क्वेश्चन, एंड इट कॉजेस सेडेशन, नींद आती है. नाउ दिस इज वेरी इंपॉर्टेंट. व्हाट आर द सीरियस साइड इफेक्ट्स ऑफ क्लोजापीन? सैम, पहला सीजर, agranulocytosis, bone marrow suppression, neutrophil count कम हो जाता है, and heart damage, myocarditis. Now the following question is, please mark this, agranulocytosis, it is dose independent side effect of clozapine. It means it can occur at any dose of clozapine, agranulocytosis or bone marrow suppression. Now, which antipsychotic drug causes maximum obesity? O से ही ड्रग है जो मैक्सिमम वेट गेन करेगा, दैट इज ओलेंजापीन. Olanzapine causes maximum obesity. Last year FMG question, least risk of weight gain. First alphabet A, last alphabet Z. A for aripiprazole एंड जिप्रासिडॉन. लास्ट ईयर एफएमजी में आपसे जिप्रासिडॉन पूछा गया है. ठीक है, लीस्ट वेट गेन. यस, इट इज द ड्रग ऑफ चॉइस फॉर रेजिस्टेंट स्किज़ोफ्रेनिया. नाउ लिथियम. लिथियम, इट इज गिवन इन द ट्रीटमेंट ऑफ बीपीडी. यू नो बीपीडी, bipolar disorder, and lithium is also an anti-suicidal drug. That means it decreases the risk of suicide. ठीक है. So lithium की half life, if you remember chemistry, lithium is the first metal in periodic table. Half life ऐसे याद कर लो, 1 day. 24 hours is the half life of lithium. And lithium is the brother of sodium in periodic table. Sodium is excreted in all body secretion like urine, sweat, saliva. Lithium is also excreted in all body secretion like urine, sweat, saliva and tears. पूछा जाता है आपसे lithium. Okay. Now which two drugs are anti-suicidal drug? One is lithium, second is clozapine. So two drugs which are anti-suicidal drugs are lithium and clozapine. Now these are the adverse effect of lithium which I have already told. First is tremors. ये पूछा जाता है. Normal dose, fine tremors. Toxic dose, coarse tremors. Now lithium causes hypothyroid goiter. It causes nephrogenic diabetes insipidus. These three side effects you have to remember. Yesterday we discussed lithium is teratogenic drug. It causes Epstein anomaly, which is cardiac anomaly. Now the question is, most teratogenic drug for BPD. It is not lithium. Most teratogenic drug for BPD is valproate. Valproate should never be started in pregnancy. ठीक है. Now let's talk about antidepressants. These names are very commonly asked in antidepressants. नाम बहुत commonly पूछे जाते हैं बेटा antidepressants के आपसे. तो पहला है SSRI, FFP, DEX. बेटा ये नाम आपको दिल से याद करने हैं. तो पहला है फ्लोवोक्सिटीन, फ्लोवोक्सामीन, पेरोक्सिटीन, सिटालोप्राम, सर्टोलिन पूछी जाती है. सिलेक्टिव सेरोटोनिन रीअपटेक इनहिबिटर, SNRI, सेरोटोनिन नॉरएपिनेफ्रिन रीअपटेक इनहिबिटर. वेलनाफेक्सिन, मिलनासिप्रान, डिलॉक्सिटीन, NRI, नॉरएपिनेफ्रिन रीअपटेक इनहिबिटर. साइड इफेक्ट ऑफ SSRI बहुत कॉमनली पूछा जाता है. देयर मेन साइड इफेक्ट इज सेक्सुअल डिसफंक्शन. दैट मीन्स दे प्रोड्यूस impotence or delayed ejaculation. Other side effect is secretions are decreased. They cause dry eyes and dry mouth. ये दो साइड इफेक्ट याद रखने हैं, बाकी के याद नहीं करने. इसी दो पे आते हैं. Now when we give any antidepressant in pregnancy, what is the problem? They cause pulmonary artery hypertension in fetus. So what is the side effect of using antidepressants like SSRI in pregnancy? They causes pulmonary artery hypertension in fetus. Next is tricyclic antidepressant. Names are very important for FMG. So either they will end with the word pramine, imipramine, desimipramine, clomipramine, trimipramine. Pramine word आएगा, पहचान लोगे. They will end with the word triptyline, amitriptyline, triptyline, not triptyline. Doxepin and dothepin is also asked from you. Now, they have lot of side effects. Sedation, why? They block histamine receptor. They produce hyperthermia. Can you tell me, yesterday we discussed hyperthermia occurs in which poisoning? Datura poisoning. Datura contains atropine. Because they have anticholinergic effect, they block the receptor of acetylcholine. They produce hypotension because they block alpha receptors and they cause QT prolongation. तो रिमेंबर द वर्ड हाइपरथर्मिया पूछा जाता है. ट्राइसाइक्लिक एंटीडिप्रेसेंट पॉइजनिंग में हाइपरथर्मिया होता है. नाउ द पॉइंट, दे हैव धतुरा लाइक एक्शन. व्हाट इज द एंटीडोट ऑफ टीसीए पॉइजनिंग? आंसर इज सोडियम बाइकार्बोनेट. So antidote of tricyclic antidepressant poisoning is sodium bicarbonate. New antidepressant drug. पहला है bupropion. Bupropion anti-smoking. Which antidepressant is anti-smoking and anti-obesity drug? That is bupropion anti-smoking drug. पढ़ा था निकोटीन वेरी बैड है ना. साइड इफेक्ट दौरे पड़ना, सिजर. Now don't confuse with buspirone. Buspirone is an anti-anxiety drug. Now trazodone, last year MCQ. Trazodone advantage. No risk of impotence. Remember, impotence is the main side effect of antidepressant. But disadvantage. Sir, उल्टा काम हो जाएगा. Prolong पिनाइल इरेक्शन. तो ये तो कुछ ज्यादा ही हो गया. दैट इज प्रियापिज्म. प्रियापिज्म. सो विच एंटीडिप्रेसेंट कॉजेस प्रियापिज्म और प्रोलॉन्ग पिनाइल इरेक्शन? ट्राजोडोन. देन वी हैव टू ड्रग, मेटाजापीन, मियांसेरिन. दे आर सेडेटिव ड्रग. दे प्रोड्यूस सेडेशन. हेंस दे आर ऑल्सो गिवन फॉर द ट्रीटमेंट ऑफ इंसोम्निया इन डिप्रेशन. इंसोम्निया इन डिप्रेशन. ठीक है. डोन इज बोन. शकीर जी. डोन इज बोन. शकीर जी इज वेरी शातिर. गुड. लेट्स टॉक अबाउट एंटीमाइक्रोबियल. सो फर्स्ट इज सेल वॉल इनहिबिटर, बीटा लैक्टेम्स. दे इनहिबिट. यू नो दैट सेल वॉल इज मेड अप ऑफ पेप्टाइडोग्लाइकन, है ना, इन अ बैक्टीरिया. सो फर्स्ट विल इनहिबिट पेप्टिडेस एंजाइम, ट्रांसपेप्टिडेस. So the drugs are pakka. Penicillins, cephalosporins, carbapenems and aztreonam. Then we have vancomycin. Vancomycin inhibit transglycosylase enzyme. And both these drugs are cidal. Now who will tell me why penicillin, cephalosporin, vancomycin, they are not effective in mycoplasma? Why they are not effective in chlamydia? And why they are not effective in rickettsial infection? Because these bacteria are atypical bacteria. They lack cell wall. इनमें cell wall होती ही नहीं है. तो MCQ पूछा जाता है. These drugs are not effective. Now let's talk about treatment of certain infections. Syphilis. The drug of choice is benzathine penicillin. Intramuscularly. It is given for all stages of syphilis except neurosyphilis. So benzathine penicillin is not effective in neurosyphilis. In the treatment of neurosyphilis, beta, we give aqueous penicillins. We give aqueous penicillins. ठीक है. Aqueous penicillin. Meningococcal meningitis, Neisseria meningitis. Treatment. Drug of choice is ceftriaxone. IV. ठीक है. Now for prophylaxis. Prophylaxis means to kill nasal carrier state. The drug of choice is oral ciprofloxacin. Remember this part. Oral ciprofloxacin. Rare infections will not be asked in FMGE exam. Rare infections will be asked in INI-CET exam. Now, this is a very important. Now, there is a bacteria known as Clostridium difficile. It causes diarrhea. It causes a disease known as pseudomembranous colitis. So, it is also known as antibiotic-induced diarrhea. Because it is due to use of antibiotic will kill normal GIT bacteria, this harmful bacteria grow, which is maximum risk of causing Clostridium difficile infection is clindamycin. Clindamycin has maximum risk of causing Clostridium difficile diarrhea. Now, what is the treatment? Treatment we will write is we give vancomycin orally. We give fidaxomycin and we do fecal transplant. Fidaxomycin is the most effective drug for Clostridium difficile infection. ठीक है? Clostridium difficile. Just remember 3 drugs. Okay? 3 drug ही याद करने हैं. Although I have told you many other drugs. Now, treatment of MRSA. You know full form of MRSA? MRSA is methicillin resistant staph aureus. Remember, it is resistant to beta-lactams. We know beta-lactams, penicillin, cephalosporins, carbapenems, and aztreonam. So, what is the drug of choice for MRSA? That is IV vancomycin. But if the patient is having VRSA, सिर्फ VRSA तक याद करना है, we can give linezolid or we can give daptomycin. ये 2 ड्रग्स याद रखने हैं. Now, topical drug. Topical creams for MRSA, that is mupirocin 2% cream. So, topical drug for MRSA, mupirocin cream. Listeria. Remember, Listeria causes meningitis. And the drug of choice for Listeria is ampicillin. Toxic shock syndrome toxin. It is caused by super antigen of Streptococcus and Staphylococcus. Now, in toxic shock syndrome toxin, we have to do 2 things. We have to kill bacteria and we have to reduce toxin production. Now, to kill bacteria, the drug of choice is IV vancomycin. Now, to reduce toxin production, we give clindamycin. Clindamycin is a very commonly asked question in toxic shock syndrome toxin. Okay, beta? Then, chlamydia and rickettsia are atypical bacteria. We cannot give cell membrane. In rickettsia, you know, there is an eschar formation. In chlamydia, there is trachoma, anise, lymphogranuloma venerum, which produce sexually transmitted disease. Now, in the treatment of chlamydia and rickettsia, we give doxycycline with azithromycin combination. So, give the combination of doxycycline with azithromycin. Both drugs need to be given. है ना? In acute attack of gouty arthritis, Dr. Harshvardhan ji, we don't give allopurinol. We don't reduce uric acid during an acute attack of gout. The reason is uric acid itself has an anti-inflammatory action. So we don't reduce uric acid during an acute attack of gout. There we give NSAIDs and all. Now, let's talk about the drugs after cell wall inhibitor, DNA inhibitor. In DNA inhibitor, we have nidazole. That is metronidazole, tinidazole or nidazole. Where we give metronidazole like drug? Remember, giardiasis. drug of choice. They are given for ulcer due to H. pylori. Okay, ulcer due to H. pylori. Then they are the drug of choice for Trichomonas vaginalis and bacterial vaginosis. Agreed? And can you tell me why they are contraindicated in alcoholics? Because metronidazole shows disulfiram-like reaction. Then we have fluoroquinolones, floxacin. Their side effect, you have to remember, they produce tendinitis. Tendinitis means rupture of tendons in old age. So remember this word. Fluoroquinolone also causes QT prolongation. It causes QT prolongation. ठीक है, QT prolongation. Yes. So you know bacterial vaginosis, there is clue cells. Then we have tetracyclines. Tetracyclines, they will end with the word cyclin and they are protein synthesis inhibitor. And remember these drugs, protein synthesis inhibitor. Now doxycycline is a renal safe drug. Which tetracycline is renal safe? That is doxycycline. And the side effect of tetracycline is tooth damage, because they chelate with calcium. Tetracycline, they chelate with calcium, tooth damage. Then we have chloramphenicol. Chloramphenicol, first side effect is it causes aplastic anemia. And in neonate, it is contraindicated. It can cause gray baby syndrome. It causes gray baby syndrome. Lastly, we have macrolide. They will end with the word thromycin. So, erythromycin and clarithromycin, they are also contraindicated in neonate. Why? Because it can cause hypertrophic pyloric stenosis. But azithromycin is safe in neonate. It does not cause hypertrophic pyloric stenosis. Recent update, there is a new macrolide which has been approved in India. A new drug approved in India, made by India. That new drug having throw word in them, नेफिथ्रोमाइसिन. अभी 2 महीने पहले आया है नेफिथ्रो, इसमें भी थ्रो वर्ड आ रहा है. सो इट इज मेड इन इंडिया ड्रग. इंडिया में अभी बना है एक न्यू मैक्रोलाइड नेफिथ्रोमाइसिन. नाउ प्रोटीन लिनेजोलिड. नाउ लिनेजोलिड, it binds to 23S subunit of 50S ribosome and it inhibits protein synthesis. Linezolid side effect is very, very important. Linezolid inhibits MAO enzyme. It has MAO inhibiting action. And linezolid causes bone marrow suppression. Then we have aminoglycosides like streptomycin, amikacin, gentamicin, tobramycin, neomycin. Side effect, 3 side effect is ototoxic, nephrotoxic, and it causes neuromuscular blockage. That means it blocks NM receptor of acetylcholine. And there is an autoimmune disease in which NM receptors are already blocked. We discussed yesterday. So these drugs are contraindicated in myasthenia gravis. ठीक है, हाँ बेटा, कॉम न्यूमोनिक हमने पढ़ा हुआ है, बट वी डोंट हैव टू राइट इट नाउ, ज्यादा हो जाएगा ना. Then we have antifolate drug, Dapsone, drug of choice in leprosy, drug of choice for one skin condition known as dermatitis herpetiformis. Dermatitis herpetiformis celiac disease में होता है ना, ग्लूटन वाले डिजीज में. Dapsone. Okay. Then cotrimoxazole. Co means combination of trim. Trim means trimethoprim and sulfamethoxazole. Oxazole, trim, CO. Cotrimoxazole. In which ratio? 1:5. In 1:5, we combine cotrimoxazole. Cotrimoxazole is the drug of choice for pneumocystis jirovecii infection. You know pneumocystis jirovecii, it produces pneumonia-like infection in HIV. Cotrimoxazole is the drug of choice. कॉमन इन्फेक्शन आपको पता होने चाहिए फॉर FMG. हाँ ठीक है, नोकार्डिया और भी बहुत सारे में यूज करते हैं, बट यही हमें याद रखना है. नाउ मलेरिया इज अ वेरी इंपॉर्टेंट ड्रग टॉपिक फॉर FMG एग्जाम. सो मलेरिया इज कॉज्ड बाय प्लाज्मोडिया. So, if the patient is having P. vivax and ovale, the drug of choice is chloroquine with primaquine. Remember the doses and schedule from PSM. ठीक है? Chloroquine, primaquine. Chloroquine is given for clinical cure. Primaquine is given as a gametocidal. Gametocidal means radical cure. Sorry, to kill hypnozoids. Hypnozoids are the dormant stages in liver. This is known as radical cure. Now, P. falciparum, it is chloroquine resistant in India. In all states of India, the treatment is ACT, artemisinin based combination therapy. So, in all states of India, we give artesunate with sulfadoxine pyrimethamine combination. While in northeastern states we give artem ether with lumifentrine. ठीक है, ये बहुत कॉमनली आपसे पूछा जाता है. ठीक है, ठीक है, अंडरस्टूड दिस पार्ट. ये नाम याद रखने हैं. लेट्स टॉक अबाउट ट्रेवलर्स प्रोफाइलेक्सिस. सो फॉर ट्रेवलर्स प्रोफाइलेक्सिस वी गिव मेफ्लोक्विन. If mefloquine is not in the option, go with doxycycline. Radical cure means to kill hypnozoid. We give primaquine and a new drug, tafenoquine, which has been asked in your exam. A new drug for radical cure is tafenoquine. Gametocidal, again primaquine. Now, complicated malaria or acute severe malaria, we have to give IV drug, and the drug of choice is IV artesunate. And lastly, anti-malarial in pregnancy, the drug which is absolutely contraindicated is primaquine. कौन सा ड्रग नहीं देना? Primaquine नहीं देना. Primaquine is not given. ठीक है? So these are the one-liners in malaria you must remember. Now let's talk about TB. The drugs for tuberculosis are known as ATT, anti-tubercular drug. So first let's talk about first-line drug. First-line drugs are given for new case of TB. And we have four drugs, HRZE. Isoniazid, rifampicin, pyrazinamide and ethambutol. Now isoniazid, you will write, it is a prodrug. Very important MCQ. It is converted into active form by an enzyme known as catalase peroxidase enzyme. And after converting into active form, it invades cell wall of a bacteria. Now, what is the side effect of isoniazid? Remember INH. It causes insanity. In insanity, remember it causes hallucination. and memory loss. It is neurotoxic and it is hepatotoxic. Now the point is, for this neurotoxicity, due to isoniazid, we give the treatment with pyridoxine. So neurotoxicity with isoniazid is treated by vitamin B6. Then we have R for rifampicin. Rifampicin inhibit RNA polymerase enzyme. It inhibits RNA polymerase enzyme. Okay. Now, side effect. Color of rifampicin is orange to red color urine. Is a side effect of rifampicin. Again, it is hepatotoxic drug, just like isoniazid. Pyrazinamide inhibit protein synthesis. And side effect is maximum risk of hepatotoxicity. Most hepatotoxic drug in TB is pyrazinamide. It also causes gouty arthritis because it increases the level of uric acid. So pyrazinamide causes gouty arthritis. Then we have ethambutol. Ethambutol is a static drug. While all other drugs are बैक्टीरिसाइडल ड्रग. कौन सा ड्रग स्टेटिक होता है बेटा? इथैम्ब्यूटॉल. इथैम्ब्यूटॉल साइड इफेक्ट ही याद रखने हैं, सिर्फ मैकेनिज्म याद नहीं है. इट अफेक्ट आइस. आइस को कौन सा ड्रग इफेक्ट करता है? इथैम्ब्यूटॉल. तो इथैम्ब्यूटॉल कैन कॉज ऑप्टिक न्यूराइटिस एंड रेड ग्रीन color blindness. Okay, so try to remember these first line drugs for TB. Now, TB in liver disease patient. Remember, most hepatotoxic drugs are pyrazinamide, followed by isoniazid, followed by rifampicin. So we have to stop these drugs. So we have to stop these drugs in a patient of liver disease. So which drug is safe in liver disease? E for ethambutol. Ethambutol is safe in liver disease. Now kidney disease patient, लिखेंगे nephrotoxic drug is again pyrazinamide and ethambutol. So the safe drugs are rifampicin and isoniazid. Now TB in gout patients, pyrazinamide. It increases uric acid level in blood. Now the question is, do not stop pyrazinamide. The reason is gout is not a dangerous condition, and start allopurinol. Start allopurinol. Understood the difference between TB in liver disease, TB in gout patient. Now TB in HIV. First give treatment of TB. Always treat opportunistic infection first, that is ATT, anti-tubercular therapy, and after 2 weeks give HIV treatment. The drugs for HIV are ART, anti-retroviral therapy. So remember, otherwise वही iris virus हो जाता है, वो हमें याद नहीं करना, ठीक है? So remember this part. Next is second line drug for TB. They are given in the treatment of MDR-TB. MDR-TB stands for multi-drug resistant TB. Now, how to remember? Remember a mnemonic BELL. BELL stands for bidaculin, linezolid, levoflox and moxiflox. ठीक है? Now, bidaculin, बेड वर्ड आ रहा है. सर जब बेड पे लेटे होते हो क्या एनर्जी खर्च होती है? सर बेड पे एनर्जी तो खर्च नहीं होती, तो मतलब बेड के बाद ए वर्ड आ रहा है. सो इट रिड्यूस एटीपी प्रोडक्शन और एनर्जी प्रोडक्शन इन टीबी बैक्टीरिया. उसके बाद वर्ड आ रहा है क्यू, साइड इफेक्ट क्यूटी प्रोलोंगेशन. लेनेजोलिड अभी हमने पढ़ लिया, फ्लोरोक्विनोलॉन्स पढ़ लिया. Then we have clofazimine. Clofazimine is also given for leprosy. And the main side effect of clofazimine is colored skin or hyperpigmentation of skin. Last year MCQ. Then we have cycloserine. Side effect CNS. Psychosis. Now remember, these two names are very important. New drugs for TB are Delamanid, Pretomanid. There is a high chance that this year Pretomanid will be asked from you people. High chances. 4-5 दिन बाद ये आ सकता है. ठीक है. Now ethionamide. Ethionamide. Ethionamide में लिखेंगे it causes T और H वर्ड आ रहा है. It causes thyroid abnormality. It causes hypothyroid goiter. And lastly, we have thioacetazone. It is contraindicated in HIV patients. So which drug for TB is contraindicated in HIV patients? That is thioacetazone. Now, what is MDR-TB? MDR-TB is multi-drug resistant TB. It is a resistance to H plus R. H plus R is isoniazid and rifampicin resistant. HDR-TB is extensively drug resistant TB. It is MDR-TB plus Bell resistance. Now, can you tell me, beta, what does Bell word stands for? Bell stands for bedaquiline, linezolid, and levofloxacin or moxifloxacin resistance. So let's call it as Bell. ठीक है? They are the most effective drug. Pre-extensively, it is MDR plus levoflox and moxiflox resistance. Now, what is the treatment of MDR-TB? That is B-PAL-M regimen. This is the most preferred regimen for MDR-TB nowadays. B-PAL stands for bedaquiline, pretomanid, linezolid, and moxifloxacin. So this is the main treatment of TB. Now, herpes virus, herpes simplex 1, herpes simplex 2, varicella zoster virus. We give acyclovir as a drug of choice. CMV is cytomegalovirus. It causes retinitis. The treatment of choice is last year MCQ ganciclovir. Now, if the patient is having Bell's palsy, sir beta, what is more important for you? To kill herpes virus or to protect facial nerve? What is more important? Remember, in Bell's palsy, the mainstay of treatment is to protect the nerves. Hence, in the treatment of Bell's palsy, first the drug of choice is corticosteroid prednisolone. Reduce the inflammation to protect nerves. It is considered to be the drug of choice. Okay? And later on, we can add acyclovir. But the drug of choice is prednisolone. Helminthic infection, one question always comes. Cestodes or tapeworms, flukes or trematode. In all infections, the drug of choice is praziquantel. Praziquantel. But there is some exception. Echinococcus causes hydatid cyst. सुना है आपने? Hydatid cyst. Here the drug of choice is albendazole. And fasciola hepatica, which is also known as liver fluke. Here the drug of choice is triclabendazole. Last year आपसे triclabendazole पूछा गया था. ठीक है? These are the exceptions. Now, all nematodes like roundworm, whipworm, pinworm, hookworm, like Ascariasis, Encyclostoma, the names you will learn in microbiology, the drug of choice is either albendazole or you can use mebendazole. except strongyloids. In strongyloids, we give ivermectin. Lymphatic filariasis, we give DEC, डाइइथाइल कार्बामजीन. ठीक है, फुल फॉर्म आप देख लेना. So this finishes our last topic of the day. Anti-cancer drug. Remember, anti-cancer drug, they produce bone marrow suppression. Except कौन से anti-cancer drug नहीं करते? लिखेंगे विनक्रिस्टीन, ब्लियोमाइसिन एंड क्लोरेम्ब्यूसिल. ये 3 एंटी कैंसर ड्रग बोन मैरो सप्रेशन नहीं करते. एमसीक्यू है. नाउ बोन मैरो सप्रेशन में होगा क्या? एनीमिया. फॉर द ट्रीटमेंट ऑफ एनीमिया वी गिव एरिथ्रोपोइटिन. एग्रीड? ग्रैन्युलोसाइटोपिनिया, द ट्रीटमेंट इज फिलग्रास्टिम. कैसे याद करें बेटा? फिलग्रास्टिम. Filgrastim is granulocyte stimulator. GRA means granulocyte stimulator. It is basically a recombinant form of GCSF, granulocyte colony stimulating factor. Lastly, thrombocytopenia. Last year FMGE question, the treatment is oprelvecin. Kin means it's a type of interleukin. ELVE means it is interleukin 11. Remember, interleukin 11 increases platelet production from bone marrow. So remember these 3 words, very commonly asked question. Now, I will not go into the details much of anti-cancer drug. Okay? Less commonly asked. First class of drug we have is alkylating agent, meclorethamine, dacarbazine. They are given for Hodgkin's lymphoma. Remember one thing in Hodgkin's lymphoma, now we prefer to use ABVD regimen. ये ABVD वर्ड याद रखना है. हॉचकिंस में हम क्या यूज करते हैं? ABVD रेजिमेन. पहले क्या यूज करते थे? पहले हम मॉप रेजिमेन यूज करते थे. देन वी हैव अ ड्रग स्ट्रेप्टोजोटोसिन. स्ट्रेप्टोजोटोसिन इट इज द ड्रग ऑफ चॉइस फॉर इंसुलिनोमा. ये इंसुलिनोमा का ड्रग ऑफ चॉइस है. ये सारे ड्रग हॉचकिंस में दे रहे हैं. ABVD आज की डेट में ट्रीटमेंट ऑफ चॉइस है. देन वी हैव साइक्लोफॉस्फामाइड. साइक्लोफॉस्फामाइड दिया जाता है नॉन हॉचकिंस लिम्फोमा. एक वर्ड याद रखना है, नॉन हॉचकिंस में हम यूज करते हैं आरचॉप रेजिमेन, और क्रॉनिक लिम्फोसिटिक ल्यूकीमिया में हम यूज करते हैं FCR रेजिमेन, फ्लूडाराबीन, साइक्लोफॉस्फामाइड और रिटुक्सीमैब. अब बात करते हैं ब्रेन के ट्यूमर्स की, लाइक एस्ट्रोसाइटोमा, ग्लायोब्लास्टोमा मल्टीफॉर्मी. इसका ड्रग ऑफ चॉइस है टीमोजोलोमाइड. It is the drug of choice. Then we have platinum compounds. They will end with the word platin. Cisplatin, carboplatin. They are the drug of choice for lung cancer and cervical cancer. Cervical cancer last year आपसे बेटा नवंबर में जब भी हुआ था एग्जाम FMG का पूछा था. cervical cancer drug of choice cisplatin, platinum वाले. ठीक है. Next point. Antifolate drug, they will end with the word trex. Antifolate drugs like methotrexate, they will inhibit one enzyme, DHFR enzyme. DHFR stands for which will convert folic acid into tetrahydrofolate, which is the active form of folic acid. So the enzyme name is, which will attach hydrogen, is dihydrofolate reductase enzyme. So methotrexate inhibit dihydrofolate reductase enzyme. Hence folic acid will not be converted into active form. Hence what will happen? Cell division will not happen. Remember, methotrexate is the drug of choice for choriocarcinoma. We just discussed methotrexate. It is given in rheumatoid arthritis. It is also given for psoriasis, like erythrodermic psoriasis. Now P-matrix, it is the drug of choice for trex word आ रहा है दोनों में, mesothelioma. It is the drug of choice for mesothelioma, tumor of pleural membrane. Now the question is, what is the antidote of methotrexate toxicity? Sir, methotrexate has inhibited conversion of folic acid into tetrahydrofolate. If there is methotrexate toxicity, give this tetrahydrofolate or the active form of methotrexate from outside. So the antidote is known as folinic acid. So folinic acid is nothing, it is tetrahydrofolate, and this folinic acid is also known as leucovorin. इसका दूसरा नाम क्या होता है? Leucovorin नाम होता है. ठीक है? Next we have pyrimidine drug, pyrimidine uracil and capecitabine. So 5-fluorouracil it is given for GIT cancer, and capecitabine is a prodrug. Its active form is 5-fluorouracil. It is given in breast cancer. Now, what is the action? What is the action of 5-fluorouracil? 5-fluorouracil inhibit one enzyme, thymidylate, MCQ है FMG का लास्ट ईयर का, सिंथेज एंजाइम. तो बेटा क्या नहीं बन पाएगा? थाइमिडीन नहीं बन पाएगा. दैट इज वाई इट कॉजेस thymidine deficient cell death. 5-fluorouracil causes thymidine deficient cell death. Now, what is the side effect of 5-fluorouracil and capecitabine? They damage the skin of palms and soles, which is known as hand-foot syndrome. It causes hand-foot syndrome. Now, like GIT cancer or colorectal cancer, the regimen is folfoxiri bevakizumab. Bevakizumab बेटा हमने कहीं पढ़ा? Folfox. Bevakizumab is inhibit VEGF. Hence, it inhibit the formation of blood vessels. Angiogenesis. Angiogenesis is the hallmark of cancer. Then, which anti-cancer drug is avoided in Crigler-Najjar syndrome? Irinotecan. Irinotecan हम Crigler-Najjar syndrome में नहीं देते. Bleomycin के side effect. Bleomycin causes pulmonary fibrosis. And second side effect is, if we can see this picture, don't you think it is looking like feathers? It is looking like feathers. Bleomycin causes flagellate pigmentation on skin. Mitomycin and also one vaccine, BCG vaccine, they are given as an intravesical injection directly into the bladder, and they are given for bladder cancer. They are given for bladder cancer. BCG vaccine bladder cancer में directly दी जाती है. So this is a toxicity which I will share in PDF. ठीक है? We have discussed each one of them. Then we have certain tyrosine kinase inhibitor. They will end with the word NIB. NIB word से end करेंगे. They are also anti-cancer drug. So first we have PIND, Baluchi, one famous restaurant, and in this try to remember imatinib, nilotinib and dasatinib. ये तीन ड्रग हमें याद करने हैं IND वाले. They are BCR-ABL tyrosine kinase inhibitor. They are the drug of choice for one tumor known as CML. CML, yes, it is. Then we have three drug SIR, SIR. They are given in the treatment of a tumor known as GIST, gastrointestinal stromal tumor, sunitinib, imatinib. Then we have PAS, PASS, PAS. They are given in the treatment of RCC, renal cell carcinoma. They are VEGFR inhibitor. They also inhibit angiogenesis. Now, the question you will find is sorafenib. Sorafenib is given in RCC and HCC, hepatocellular carcinoma. Sunitinib, it is given for treatment of RCC and gastrointestinal stromal tumor. Now, non-small cell lung cancer, the most common mutation is EGFR mutation, epidermal growth factor receptor mutation. We have EGFR inhibitor, erlotinib, jeftinib. ये दो नाम याद रखने हैं. Venditanib, Vande Mataram. Mataram means it is given for M for medullary carcinoma or cancer of thyroid. Venditanib. Now, few monoclonal antibody. Trastuzumab. Trastuzumab blocks or inhibit HER2 receptor. HER2 receptor, and it is the drug of choice for HER. HER means female gender, HER2 positive breast cancer. ठीक है, HER2 positive breast cancer. So how we can remember? Remember a mnemonic, trust her. Remember a mnemonic, trust her. याद कर सकते हैं ट्रस्ट हर. अब एक बात बताओ यार, अगर आपका ट्रस्ट टूट गया, अगर आपका ट्रस्ट टूट गया, उसने आपको रिजेक्ट कर दिया, कहां पे दिल हो, कहां पे दर्द होगा आपको? ट्रस्ट टूट गया आपका, योर ट्रस्ट हैज बीन ब्रोकन, योर ट्रस्ट हैज बीन ब्रोकन. कहां दर्द होगा? कौन से ऑर्गन में? कौन से ऑर्गन में दर्द होगा बताओ यार? यस, सो ट्रस्ट हर. अगर ट्रस्ट टूट गया, साइड इफेक्ट ऑफ ट्रस्टुजुमैब इज कार्डियोटॉक्सिसिटी. एमसीक्यू है ना? नहीं, वहां पे नहीं होगा कार्डियोटॉक्सिक. अब सर आपका ट्रस्ट टूटा, आपके दिल में दर्द हुआ, आपको गुस्सा आएगा. अगर आपको गुस्सा आया तो आप क्या करोगे? तो आप क्या करोगे? अगर आपको गुस्सा आया, उस लड़की के पास जाओगे, उसे क्या करोगे? उसको लापा मारोगे. इन ट्रस्टुजुमैब रेजिस्टेंट केसेस, a drug which is given is lapatinib. MCQ है, FMGE का है बेटा. Lapatinib is given in trastuzumab resistant cases of breast cancer. ठीक है. Cetuximab blocks HER1 receptor, which is also known as EGFR, epidermal growth factor receptor, given for colorectal cancer. नाउ लास्टली हमने पढ़ा था रिटुक्सीमैब. तो याद करो, एक लड़की है रितु, उसकी एज है 20 ईयर्स. उसकी एज क्या है बेटा? 20 साल. सो रिटुक्सीमैब ब्लॉक्स CD20 रिसेप्टर. जैसे ही उसकी 20 ईयर्स की एज हुई, उसकी जॉब लग गई. कहां जॉब लग गई बेटा? रिलायंस में जॉब लग गई. So rituximab, it is given in the treatment of rheumatoid arthritis, lupus erythematosus or SLE. It is given in the treatment of ITP, idiopathic thrombocytopenic purpura. It is given in autoimmune hemolytic anemia. It is given in two cancers which we have already discussed, non-Hodgkin's lymphoma and CLL, chronic lymphocytic leukemia. ठीक है. Last topic, immunosuppressive drug which reduce immunity, they are given in the treatment of organ transplant people. We have to reduce immunity, and the drug you have to remember is calcineurin inhibitors. And the first drug is cyclosporin. Second is tacrolimus. Tacrolimus is also known as FK506. They are the drug of choice for organ transplant people. The side effect of cyclosporin and tacrolimus is they are highly nephrotoxic drug. And cyclosporin, just like phenytoin, also causes hirsutism and hyperplasia of gum, hyperplastic gums. Another drug is mycophenolate mofetil. Just remember this part, and this finishes your pharmacology. कौन बच्चा पूछ रहा है कितनी देर का बचा? चलो, so I finished everything as promised. तो अच्छे से पढ़ लेना बेटा एग्जाम से पहले. So now we will end our session. Okay, चलो, कोई भी डाउट हो पूछ लेना. The last minute tips for pharma is before your exam, just give 1 or 2 hours, see this lecture. जितना याद हो सके करना, ज़्यादा टाइटली पकड़ने की ज़रूरत नहीं है चीज़ों को. अगर पहले नहीं पढ़ा, पहली बार पढ़ रहे हो, जितना याद कर सको कर लेना. ठीक है, जितना आराम से याद हो कर लेना. एग्जाम में आपको याद आ जाएगा. नहीं आया कोई बात नहीं, FMG का एग्जाम क्वालिफाइंग एग्जाम है. आपके 150 आए या 250 आए, एक ही बात है. है ना। बट पढ़ के जरूर जाना, फार्मा इज हाईली स्कोरिंग सब्जेक्ट, बहुत सारे क्वेश्चंस आते हैं, पूरी फार्मा ही भरी होती है। ठीक है। In mock test, when you're starting with pharmacology, at least aim for 70%। 60 से 70% से आपकी शुरुआत होगी, धीरे धीरे उसे 80 to 90% पे लेके जाइए। एक बात मैं श्योर करता हूँ, टफ एग्जाम्स जो होते हैं लाइक INI CT के एग्जाम और नीट के एग्जाम, बहुत ही कम बच्चे हैं जो 100% स्कोर कर पाते हैं फार्मा में। ठीक है, 80-90% विल बी अ वेरी गुड स्कोर, वेरी गुड स्कोर इन फार्मा। इस क्लोरोक्विन की डोज लिख दिया बच्चे ने, 25। अनिकेत जी, हाँ सही है बेटा अनिकेत, बिल्कुल ठीक लिखी है आपने डोज। या इफ यू हैव एनी डाउट्स यू कैन आस्क मी, आई विल बी हैप्पी टू आंसर। ओके, याद रखना आपका कंपटीशन आपके अपने आप से ही है, किसी और से नहीं है। अपने आप को इम्प्रूव करोगे, कंपटीशन ऐसे ही जीत जाओगे। किसी और से नहीं कंपेयर करना, दूसरे लोगों से इंस्पायर होना है, कंपीट नहीं करना। अगर कोई बच्चा ज्यादा पढ़ रहा है, मेहनत कर रहा है, हमें उससे इंस्पायर होना है और उसकी तारीफ करनी है कि हमें भी ये चीज को अपनी हैबिट में इनकल्टेट करना है। ये बात याद रखिएगा। ओके, चलो बाय, थैंक यू।